Andhra. But with Andhra, they lost, they went to the other side of the Slough. Because a lot of calls are coming every minute. And I know there are not many candidates and a lot of people didn't get the visa. So I'm happy it's not big. Yes, doctor? And we are going to start the program. Let's have a good feeling, good confidence, good information, good lunch, and we will enjoy the whole day.
Indian lunch?
No, Bharatiya lunch. Bharati. Dr. Dwivedi is from Indore. He is very popular doctor in India, around the world actually. He is a president's doctor. So I invite Laura to welcome all you in your language, Bulgarian language.
Okay, thank you, sir.
Please come here, please.
Okay.
She is one of the best doctors in.
Am I audible? Okay.
Yes.
Okay, I'm Laura from Bulgaria, and I'm Deputy Director of CHI Bulgaria, a branch of CHI London. So I'm going to welcome my students. Most of them are here in Bulgarian language, if you allow me. Благодаря ви, че сте част от това мое преживяване тук. Благодаря ви, че дойдохте да ме подкрепите и се надявам да научите много от мен. Thank you. Thank you very much.
Thank you, doctor.
So, at the outset, let me thank Dr. Sharma because he is the mentor and he is behind this for many, many years. Because I remember coming here in 2013 when I did PG Homeopathy London, and he was my mentor and he's still my mentor. So this time I'm just helping him out, nothing like a director or anything. He's still the director and we're still going to do it, only that we're going to help him to do more and more. So anyway, we'll start with the seminar today. So 2 or 3 people from our group did not get visa, but they are going to present. So we have kept them on Zoom. From India, they'll be presenting. So the first presenter is Dr.
Yeah, go ahead.
So we are pleased to introduce Dr. Rajeshri Undale from Belgaum, Karnataka. She's completed her Bachelor of Homeopathic Medicine and Surgery from Bharatiya Vidyapith, Pune, and obtained her MD from Bhartesh Homeopathic Medical College, Belgaum. Dr. Undale has around 9 years of clinical experience, 2.5 years teaching experience, and her expertise lies in managing chronic and complex disease conditions including oncology, cardiac disorders, male-female infertility, gynecological conditions like fibroids, PCOD, endometriosis, and musculoskeletal disorders, intervertebral disc prolapse, and spondylitis. She continues to contribute actively to both clinical practice and academic development in the field of homeopathy. Today she is going to talk on CA of ascending colon and homeopathic management and her cases in oncology. Okay, so welcome Dr. Rajeshri. Can we have you? Dr. Rajeshri, can we have you on the camera? Open the audio. Presentation.
I would like to express my sincere gratitude to the organizing committee for providing me this opportunity and for creating a platform to share my clinical experiences that truly reflect the scope and potential of homeopathy. The case I am presenting today represents not just a medical journey but also a message of hope how individualized homeopathic intervention can bring meaningful improvement and quality of life in the conditions where conventional options are limited. So let's begin with a brief overview of the case history and the therapeutic approach adopted in the patient. So today I am presenting a case of CA ascending colon. So what we see is there are almost 4% of colorectal cancer which contributes towards India's cancer incidences and mortality. Among few, we see that there is only 34% chances of survival in the next 4 to 5 years of treatment. Next slide. So today we will be discussing about the patient 21, she had a case of pyelonephritis, and after 3 years, that is 2024, when the patient approached to us, she had chronic liver disease changes along with a diagnosed case of well-differentiated adenocarcinoma of ascending colon. So, if we see the review of systems, here we see there is pancreas involvement, then we have the kidneys, the liver, and lastly is the colon. So, when the patient approached to us, that day her random blood sugar level was at 254 mg per dl. Her reports, that is a CT abdomen, showed there was pancreatic calcification of the kidney with presence of cortical cyst, with changes in the chronic liver disease and a tumor in the ascending colon. On the interview findings, we noticed that though she had ravenous appetite, but few mouthfuls made her, she was full. Also a biopsy report which suggested that it was a well-differentiated adenocarcinoma. So here we have a diagnosis of adenocarcinoma of ascending colon. So without much discussions, or without even repertorization, the first remedy which flashed with all the complaints, we could see that a remedy called as cinnamon salve. Even while inquiry, we found out that there was history of malaria. So there's only one remedy which comes up, is cinnamon sulfuricum. So after going through Robbins Murphy's Materia Medica, regulated Materia Medica, we know, sir, that there was violent cutting, colicky pain in the region of transverse colon, which was after eating. Along with that, there was splenomegaly, which was present after the intermittent fever. We see the patient also had a malaria, the closet had reduced. So without any change in the prescription, we kept her on Matramune 30 HS and Cardus Marinus OD. So what we learned from this case over here is either you can be a victim of cancer or a survivor of cancer. So it is just a mindset what it is. So this patient who remained hopeful is even still hopeful, and we see that the pathology or the involvement of multisystems what was present had come down. The liver was normal, the splenomegaly had reduced, then the pancreatic changes which was hampering the parenchyma, it changed into the calculi which were being passed out, and the size of the tumor reducing. Though her diabetes was still on a better ground, her random blood sugar had come to 150, 200. So we could see there was general improvement of the patient what we have seen, though in 1 year timeline of the treatment. And here the patient did not adopt any kind of conventional means, let it be antibiotics or pain. This case reminds us that every patient carries a story of resilience and hope. Through individualized homeopathic treatment, we not only address the disease but also the deeper layers of the patient's vitality and healing potential. As we have seen that the number of systems what were involved in this patient, we have reduced it. So while the conventional means offers a precision and palliation, homeopathy provides a human touch that rekindles hope, often beyond what statistics and prognosis may predict. This experience is
So thank you Rajeshri for an excellent presentation and rapidly how anti-malarials are used, but in susceptible individuals how these anti-malarials can lead to malignancy, and then how we can palliate it through homeopathy. And it's not only what we can give to the patient, or there is no question of cure, but at least we can palliate and give them a good quality of life. That's what homeopathy does. So thank you very much, Rajeshri. Thank you very much. We can give her a
Thank
loud
you, sir.
applause. Thank you very much.
Thank you, sir.
Treat that case. First of all, let me introduce myself. I'm Dr. Sukhjeet Kaur. I'm running my own clinic in district Faridkot, Punjab as of now. Earlier, I was working as HOD professor in the Department of Homeopathic Materia Medica in Shri Guru Nanak Dev Homeopathic Medical College, Ludhiana. And it's been almost like 2 decades I'm working and specializing on the cases in infertility, be it the male fertility or the female infertility. Here are my contact details. Next, please. So first of all, let us introduce what actually infertility is. Infertility nowadays, what I say is because of the poor lifestyle and overuse of regular hormonal tablets. It is affecting 10 to 15% of the couples globally. And it is a multifaceted issue with medical, psychological, and social implications, as we all are aware of. It is defined as inability to conceive when you were trying for 1 regular year without any protection, but you were unable to conceive. The common causes include hormonal imbalances, tubal blockage is one of the reasons, anovulatory cycles are one of the reasons, lifestyle factors are there. Lot of psychological stress nowadays is playing a major impact in causing infertility in so many couples. Modern medicine friends, they prescribe the hormonal therapies or they have the surgical procedures, especially like in the cases of uterine fibroids, or if there is like some varicocele is there in the male, or there are assistive reproductive technologies like IVF is there, IVF like in vitro fertilization is there, and IUI is also there, in which the intrauterine inception is given. But usually the patient is, normally not comfortable going through these procedures, and the success rate is hardly like 30 to 35%. Always standard firm on her own opinions. As I told earlier, she had a very strong thing that I am for sure going for C-section, and eventually she opted for C-section only. She didn't go for the vaginal delivery, and she barely cries or displays a vulnerability. She is a very strong-headed woman. But she always had a marked anxiety about her own health, about her family, especially the well-being of her husband. And she had a strong history of getting sudden panic attacks. Next, please. So what investigations we did were, HSD was done previously. When she came to me, she had that hysterosalpingogram done, which was conducted, which showed vivid appearance of bilateral fallopian tubes. And as we studied, vivid appearance of these fallopian tubes indicates tubercular infection. Her testosterone level was 63.1 mg per dilution. This HSD was done on 4th of July 2023, which was done before consulting me, right? And these hormonal assay was done in our clinic only. So these were conducted on 2nd of April 2024. Testosterone level was 63.1. AMH, that anti-malarial hormone, was 8.91, which is pretty much on the higher side, I must say, because when you have a higher side of AMH, even then it causes a hindrance in getting pregnant. Because eventually your follicle 3.91. Next, please. So this is the report she brought. Also vivid appearance of the tube-loaded spell seal. So this was the tuberculosis of a bilateral fallopian tube, and the tubal blockage was there. Next, please. So here is the repertorial analysis. What I took into consideration were female sterility, female menses irregular, female pain, uterus and region, stool urging to bearing down. As I told earlier that she had that pain. Mind, fear, something will, husband, that he would never return. This is a very peculiar symptom which she mentioned. She had delusion better than others, anxiety in paroxysms, anxiety sudden, anxiety about the health of relatives, anxiety about her own health, disgust for everything, and in food and drinks, general. Next, please. Yeah, these are my details. If any one of you want to contact me, so you can note down my number or the email ID is there. Thank you. Thank you for listening. Thank you for being so patient. Thanks a lot.
go on a break for a few minutes. Somebody want to go to the bathroom?
Yeah. So thank you, Dr. Surjit, for an excellent presentation, and just shows us again that how homeopathy can be an excellent therapy for infertility. When the normal other therapies do not really support, homeopathy can bring rise to such nice homeopathic babies, right? Thank you very much for your excellent presentation. Thank you.
Thank you, sir. Thanks a lot. Thank you, everybody, to be patient to listen.
Dr. Samir asked if they want to go for the break.
Let's have a 5-minute break, toilet break, and we can start with.
Okay. Is that okay? All right. Okay. So, sorry. I'll start again. First and foremost, I must thank Hanuman College of Homeopathy and Dr. Sharma for giving us this platform, where we are not just able to share what we do, but we are able to learn from the others. We are able to exchange ideas, and I so wish we could have started on time, because I would have gathered some of your points in the case also. But today we'll have to skip that, and I will try to concise the case. Also concising my own introduction, I am practicing since 2003. I was here in UK for a few years, and I have moved on to practicing homeopathy right from the college days, the textbook method, the mind, the Kantian method, the mind and the physical journals and the characteristics and all of that. I moved on to practicing with Dr. Shankaran for a few years, learning the sensation and the wise method also. And then, since pandemic, I have got this opportunity of practicing the mind method, which is taught by HHF India. So, whenever we start any presentation, I have learned a wonderful thing from HHF is we begin with seeking blessings and gratitude from all of whom we have learned with. And that puts us very humble and grounded. So going down to the masters, next. Going down to the Mahagurus of the mind method, late Dr. Milind Rao, Dr. Ashok Mohanty and Dr. Narendra Gupta. Next. These are my teachers in homeopathy. I really owe them a lot. Next. And all these, this is the whole HHF team full of the HHF senior practitioners and mentors, and we have really learned a lot from them. A little before that, in almost July 2022, he was clinically diagnosed as Asperger's syndrome. And the parents, as usual, were in denial mode. They didn't want to accept that their child is a special child or has a little bit defect in the way he presents himself. And they were trying all by themselves. They didn't want to go on to any therapy, no homeopathy at all. So they spoke to me, they went back, they did the reports, and when the reports and the CARS score showed that there is something they need to address, then they came back after a short span of therapy also, when it did not work. So next. This is the reports. The report will show, if we can zoom in a bit, or else you can check, the IQ is also little less. So at the age of 5 years and 4 months, his socialization is 3 years and 8 months. And his communication skill is 4 years. And when they showed this CARS, I don't know how they did it, but they didn't give the count of the CARS. This was just the description of the test that they did. And there is echolalia, there is non-verbal communication is not happening. And on number 14 and 15, there are some concerns. Alright, if you're not able to read it, it's fine. We will go to the case. Because the mother will still be talking about all of these in her own concern language. So next. That was the report before, and I'm going to show you the report, the recent academic score of the child. The child has gone to regular school, and within 1.5 years of this treatment, he has scored a grade A in his school, and almost you can see A1 everywhere, whereas the IQ of the child was low than normal. Next. So how did this happen? It happens only with individualization, as we just saw in the case of infertility and the case before that. What was individualization in this case? The mother came with all of the symptoms, And then we also have the family history and the background. So usually in the cases, I start with the family background. We need to understand something in context of the family. The paternal grandfather was at home most of the time because he had left his job for many years to take care of his ailing wife. And the father had a sister who was living in UK. The mother also has a small family of her own, her sister, her parents, and that was all about it. You can read the rest of it. Next. This is the case. We usually, when we do presentations with HHF, we do the live cases, and this was a presentation for them, but we'll skip this for the minute. Next. I'll just go through the script of the video, the audio. So, mother said, he doesn't sit and he keeps moving, which is the main concern, and therefore the schools do not accept him. During that point of time, the schools were not accepting him, and he had to change a couple of schools previously, staring at them. If there is any group activity, he will never stay there, and he will isolate himself. He will do everything to just go away from there, okay? Next. So younger kids especially, he would not like at all. Even if they are not crying, he would find them weird, and he would not like to be near younger kids. Then other fears I asked were fear of dog. That was because mother had instilled that fear, which is very normal. But if there is a mixer grinder going on at the house, he would really feel very scared, and he had to be explained by the parents what it is, and he had to be concerned. He would keep busy in his notebook. At home, he would keep talking to himself. And he counted numbers, is obsessed with numbers, and he constantly stays with a person who he feels safe with. What is this? This is, the mother's concern is over now. So I'm asking the mother, how does he adapt to the stress that he faces? Next. Okay, so that was all about the child, and we understand it is Asperger's syndrome. Now how we go about it in the case? We try and understand what Asperger's syndrome is. Then next, we know the symptoms and common signs of Asperger's syndrome, and we still check because we want to rule out what is individualizing in a case, right? Next. Also, when we want to rule out what is individualizing in a case, we go with 3 P's, that is persistent, present, and predominant. And with all of them, what has to be there, even if it is the common symptom of that disease, what has to be there is the morbidity of its. For example, the child is anxious with people in the room. Most autism children are anxious, but what qualifies that anxiety? What is morbid in that person? How much is it affecting him? That is also very important. Then we try to understand what brought on the Asperger's syndrome in this child. So I looked up the causes of Asperger's syndrome, and there are 7 causes. If you want, you can take a picture of this. Next. This is commonly found. The causes of Asperger's syndrome in the previous slide are commonly found. But what we need to understand more than all the physical aspects that are taught to us is the emotional aspect. Right? Because in the previous courses also, the conventional system mentions about the stress, which also leads to such conditions. But we need to understand and qualify the stress. How do we do it? There is one thing called the psych. What we should understand as a holistic prescription, we always talk about is the what. What is happening, we always emphasize upon that. But why it is happening? And how the case is presenting to you, how the case is coping up also with the stress that is perceived. So the what, why, and how are the 3 legs of the stool that we can lay our prescription on. The mother's history in such cases, and the most important learning I had was that in such cases, because there is a developmental anomaly, the child also evolves, and there are different states that come up. So the child needs different remedy when the state changes. This child did very well up till CIPRA 10M, and then the state changed, and he was given other remedy, and now he's still doing well, but he is on some other remedy now. Thank you so much for being so attentive. I hope you really
Very good, very good. Sharma ji, take a picture with me and she is very honest. At one point she said, I even didn't know about the remedy. A lot of people think they are superpower and something. Thank you, sir.
I'm from Andhra Pradesh, India, and I'm a professor in Department of Community Medicine in Guntakal, Shasha College, and I've been practicing from past 7 years. Okay. Okay, all right. No, the while isn't that long, so.
Let me take one and then
Us to manage these cases, and there's a small case of mine and I'm trying to present in this. Okay, let us see. What is diabetes mellitus? It is a simple disease where you eat something, it goes into your stomach, the starch or the bread is being broken down into smaller fragments, and the smaller fragments are called as glucose, and this glucose gets absorbed into your bloodstream, and that glucose is helpful in producing energy, the currency of our body, which we call it as in our low classes we have understood it, which is called as ATP, adenosine triphosphate. So this will help in a cycle called as Krebs cycle. Hope you must brush up your memory of your memories from your school days. So this is called as Krebs cycle, where this ATP is very much helpful to. Now what happens? To put glucose into the cell, you need one thing called as insulin. Okay, let us take this concept very easily. If you want to enter this door, you need an access key, right? So like that, if the glucose has to enter into the cell and it can produce energy, you need one access key, which is called as insulin. And there is one more thing to this. If you want to close that door, or you want to shut it, you need another key to lock the door so that the glucose doesn't enter inside the cell, and you need one more access key, which is called as glucagon. Okay, I hope this is clear for us. Okay, move on to the next one. Yeah, now what happens here? Glucagon we'll go to the next one, please. Yeah, okay. Now what happens in diabetes? So let us take this. Okay, when you eat food, when it is in the stomach, now what happens? Stomach gives a signal to your pancreas. In pancreas, there are two types of cells, which are called as alpha cells and beta cells. Okay, we will concentrate more on the beta cells. Beta cells soon after releases insulin. The moment it gets into your duodenum, and starts getting absorbed into the body fluids, into the blood. Now what happens? The insulin is already circulating in the blood and asking each and every cell, do you need it? Yes, okay, I need it. So that's how it is being taken. When the blood glucose levels go on rooftop, when it goes on circulation and goes to the beta cells, and beta cells sense that, oh, there is a lot of glucose, there is a lot of glucose inside, and it kicks in the feedback mechanism, and which reduces by secreting glucagon, and the blood sugar levels goes down. So this is how the cycle goes on. Now what happens here is, there is some problem, and these people who are suffering with diabetes are unable to produce insulin. They keep on eating, and it will be going into their blood sugar. But the sugar which is present inside the blood is unable to get inside the cell, and they will feel constant hunger in them. So that's why most of the diabetics tend to eat more, and after eating, after a few hours, again they feel hunger. Because they are unable to put glucose inside the cell. Okay, so now you can see in this picture, okay, so there is an insulin resistance. This is the insulin molecule which has been secreted by the pancreas, and they are unable to enter inside the cell. Yeah, now what has happened? Now when they are not responding, now what are the risk factors, and who and all these people are developing diabetes mellitus? Now let us take it. There are common risk factors, and these risk factors change time by time. Okay, you take the textbooks, the edition changes, the risk factors changes. So that's the funny thing about the modern medicine. So let us see it. Now what they say, it's because of genetic, yes it is, and then it is hypertension, and then is lack of him. Counsel him, this is not the way you have to address, this is not the way you have to see the world. Probably I'm younger than him, and I tried to counsel him. Then we started having more and more conversations on how personal behavior of a patient, like a personal behaviors, how people behave, what is interpersonal behaviors and all these things. Because he is a very good intellectual, and we started conversation. I consoled him along with the medication. In meanwhile, the second prescription plays the role. Meanwhile, when he was getting stable, I chose syphilis because he had a history of cancer. His family has a history of cancer. He already survived cancer, so that's why I didn't choose carcinosin. That was the reason why I didn't choose carcinosin in this case. So that's why I gave him syphilis, 1 1 dose in between. After syphilis, because it is an intercurrent, I gave him causticum again 30, followed by 200, then followed by 1 and in a span of 1 month gap. And this is approach when I was just about to fly to England, which is on the 10th of October. His HbA1c is 6.3. The average glucose is 134, and his fasting, is 134. Then the fasting sugar is somewhere around 109. This it is 109. So this is an excellent case. We have traveled from 13.4 to 6.3 in a span of from the month of May to the month of October. So this is a case, this is a freshly diagnosed case with a natural symptoms and all these things. And if you can diagnose a case as early as possible, if you can counsel the patient and put them on the proper diet and the proper medication, and thanks to this person, this gentleman, actually I don't take any credit in this case, because the patient who has really taken the entire course on himself, and he has followed every instruction of mine, and then these results are really possible. And these results are really possible. And this is what is the case for us. And I hope my presentation would help you in understanding the cases. The last one. Yes. I would like to, any suggestions from your side with your experience?
It would be too much to his biodata is for many pages, so I will not be taking too much time. But he's a very famous doctor, a famous homeopath in India, and has received accolades from the President of India also. He's attached to a homeopathic college in Indore, and today he's going to talk of a very good and a very rare condition, which he will of course tell us. So Dr. Dwivedi, please.
Try to talk without microphone because there is no echo.
Just okay. Do this action.
Thank you. I am working basically on bone marrow disorders, doing a lot of works on aplastic anemia. Aplastic anemia means the bone marrow stops production of RBC, WBC and platelets. But today my topic is hematohydrosis. What is hematohydrosis? That is written in this book. So you can full remedy for hematohydrosis. Thank you, Henneman College of Homeopathy, United Kingdom, for giving me this opportunity. Myself, Dr. A.K. Dwivedi, I will give my introduction later on. What is hematohydrosis? See the very dangerous pictures. This is the real picture of my patients. Hematohydrosis. Here the topic is hematohydrosis, means blood in sweat. During an episode, small blood vessels capillaries surrounding sweat glands ruptures and allows blood to mix with sweat, which appears as reddish, pinkish droplets on the skin. You can see these are the real pictures of the patient. These episodes can occur on the face, scalp, palm, any other parts of the body. It is not a sign of internal bleeding, but usually reflect extreme emotional or physical stress. The phenomenon has been mentioned in the ancient text and documented in modern medical journals, but it remains poorly understood and often misdiagnosed. Why does it occur? Severe stress or emotional trauma, sudden fear, anxiety, emotional shock can trigger the activation of the sympathetic nervous system, causing blood vessels to constrict and then dilate suddenly, leading to leakage of blood into the sweat gland. Overactivation of nervous control, sweat glands can disturb normal vessel regulation. In rare cases, platelet or clotting disorders, vasculitis, or high blood pressure may be contributing factor. Viral bacterial illness may temporarily increase the capillary fragility. Psychological factors, fear, guilt, suppressed emotion, or high academic pressure, especially in students, can play a major role. All the cases are during teenagers, from 15 to 19 or sometimes 23, 24 years, but major cases I have seen is in between the teenagers. Exciting and maintaining causes are intense fear, anxiety or shock, examination stress in students, emotional conflict or loss, anger or frightful dreams, physical exhaustion or sleeplessness. Maintaining cause are continuous emotional tension or family stress, repeated exposure to stressful environment, lack of sleep and improper diet, excessive caffeine or stimulus, neglecting psychological support or counseling. Homeopathic medicine can help. In all the cases I have used Hamamelis mother tincture, but I am giving you a handful remedy here. On the basis of totality of symptoms, I have never using repertorization. Only on the basis of symptoms totality I am prescribing. Aconite Nepalus for sudden attacks after fright or shock, face flushed, pulse rapid, fear of death. Belladonna, congestion, heat, redness, throbbing of head, sudden, violent and onset. Arnica montana, bleeding due to capillary fragility or physical exertion, soreness and bruise feeling. Phosphorus, bleeding tendency with weakness, faintness and emotional sensitivity. Ignitia, for grief, disappointment, suppressed emotion and psychosomatic complaints. Pulsatilla, gentle, emotional children's adolescents with fearless, tearful and craving for attention. Natum muriaticum, reserved, inverted patients with grief, exam anxiety and emotional suppression. Pulsatilla, Natum muriaticum, Gelsemium, and so many medicines. Somebody was talking yesterday about Crotellus horridus, but I have never used Crotellus horridus. But in all the cases, I have used Hamamelis. What we can use to prevent these attacks? Stay calm and हमारा भारतीय फूड जो है गुड़ और चना, jaggery and gram, and milk with turmeric to increase the immunity या prevent frequent sickness. And other thing is to boost immunity, best is tulsi leaves or herbal tea of tulsi. And I have prepared a chart like this: भुना हुआ चना, गुड़, गरम दूध हल्दी के साथ, बादाम, रोस्टेड almonds, सोयाबीन, spinach, papaya, dates. हमारे यहाँ सत्तू चलता है. Then आंवला कैंडी या आंवला मुरब्बा, carrots, spondula, sugar beets, apple, pomegranates, raisins, dry dates, munakka, fig or fish. These are always helpful to increase the blood. This is about me, a renowned homeopathic physician, as Dr. Sharma always says. I had got a chance to meet our President of India, Srimati Draupadi Murmu ji. I am very much thankful to her for asking me to tell her about the treatment of sickle cell anemia, role of homeopathy to treat the sickle cell anemia. And I am thankful to her for making plan in the budgets of India 2023 about the anemia. Bharat Sarkar is trying to make free our country by 2024 from anemia. So thank you. I am publishing this magazine Sehat Yom Surat every month. You can get it free download from sehatsurat.in. Thank you to all. I am available on these all platforms. Thank you.
Welcome, Dr. Dwivedi again.
चलिए, आप कहाँ चले गए?
Dr. Sajid from Pakistan was waiting outside.
Oh.
Have a seat, have a seat. When I met him first time, I saw and noted his interest in homeopathy, dedication to homeopathy, and I see him as my future.
Oh, thank you, thank you. Thank you.
Thank you very much for giving him good time. So now, next speaker is Dr. Samir Chokar, the problem creator. Why? This is happening because of him. So anything good, say me, tell me, thank you. If anything bad, he is to be blamed.
Thank you very much. Okay, so we don't have too much time, so we'll go directly to the topic today. But every year, every day, every minute we are evolving, we are trying to understand more about autism and how it is a spectrum. So Kruti talked about the Asperger's syndrome today, so which is on the extreme right of the spectrum, where you have got absolute intelligent children who don't have any problems with communication. Yes, there might be some problem with eye-to-eye contact, but otherwise they are very, very intelligent. So in the autism verbatim, it is known as autism savant children. So all of you must have seen the movie where there is a guy. It was a Hindi movie, of course, where he was autistic, he was Asperger's, but he was able to do calculations very fast. So these are the children who are extremely intelligent, extremely savant, and therefore our remedies like carcinosin, our remedies like lattices, our remedies like phosphorus do work on them. Now on the other side of the spectrum, you have got people or children who are mentally retarded, who are not able to understand. So autism is along a spectrum. And if we look at the miasmatic aspect of autism, it goes from SORA to psychosis to tuberculosis to syphilis. On the one side of syphilis, you get the entirely, mentally retarded children along with comorbidities like Down syndrome and all other things. On the extreme left, you will get the Asperger's syndrome, where they are very, very intelligent. So you will have soric children, you have tubercular children also. So this is how it goes. So let's start with autism spectrum disorder. It is a journey through the solitude. An autistic child's biggest need is to be understood. It begins early childhood. Now remember, autism, as we all know, has to be caught early. Autistic children, as they grow, it becomes much more tougher and more challenging even with homeopathy to treat them. Though I have got autistic kids or autistic adults, 19 years, 26 years also, but it becomes very, very difficult to bring back to normalcy. Remember that. So 18 to 24 months, while there is no cure for autism spectrum disorder, intensive early treatment can make a big difference in the lives of many children. In India, of course, ASD is increasing by leaps and bounds. The first thing, now I always used to think about a lot of other things, but the first thing post-COVID was excessive gadget, remember. Too much gadget use, too much video, too much, looking at the TV, especially when the schools were not there. Children were glued to the computer, children were glued to the iPads, and that led to a lot of autism, remember, and of course the vaccine also played its role. So if child is exposed to a lot of screen or gadget time, constant visual and auditory stimulus, the nerves are constantly working and the brain does not get chance to shed off the weaker nerve. Now this is very, very important, that when the child is in the womb of the mother, around 6th month, 7th month, there is called pruning of the synapses. Because the child, when he is in the womb, there are a lot of synapses and they are all mixed together. Slowly, as the child grows in the womb and then post-delivery, these synapses are pruned. That means they are cleared off. What is not required is cleared off. But what happens, and therefore the mother's history during pregnancy is so very important, that a mother, when she is disturbed, abused, or when she is too much overworked during pregnancy around these months, when the pruning of synapses occurs, that is when the problem occurs, and that is when autism can play a very, very important role. So this pruning of synapses becomes very, very important. Second, of course, is vaccination, infections, consanguineous marriages, mother's health during pregnancy. Now, of course, hypoxia also plays a very, very important role. So much so that one of our friends who's dealing with autism in southern part of India, he started a HBOT therapy where they are giving oxygen to children, oxygen given to children with autism, and they are improving in a lot of their functions. So oxygen also can play a very, very important role. But genetic predisposition is required. You can't just blame the vaccines. If vaccine can damage, only if there is a genetic predisposition, what we call fundamental biasm. So genetic predisposition and environmental toxin will give rise to autism. There are three basic issues, as we all know: behavioral issues, speech, language and communication, and third is social skills impairment. There are certain tests. Dr. Kruti already talked about CARS, which is a very, very important test, childhood autism rating scale. Now, this is one which we always need to do, which we always need to have as evidence base. We have to reverse the CARS score, remember that. CARS beyond 30 or beyond 32.5 is autism, mild, moderate, severe autism. It comes below 30, that means we have made the child not autistic. That's very, very important. That's what we are going to see today. Other tests are ATEC, then there is a VSMS or social quotient. Now when we make the totality of symptoms, this becomes very easy, that when there is a totality, the child comes with a lot of mixed symptoms. But he will come up with one predominant pattern, and one of the patterns is too much hyperactivity, which is known as the kinetic pattern. So you will see an autistic child, when he enters into your clinic, he'll come running here and there, start pushing things, start destroying things, start throwing things. That is the kinetic pattern. Another child comes with a lot of sensory pattern. That means little noise and he'll put his hands on his ears. He cannot bear bright light. So all the senses are affected. And the third type is the regressive child, where the child will come, he's applying saliva to the board, passing stools, there is no control over the bowel and bladder, and he's even eating his stools, remember that. So these are the three patterns that you will see in autism, remember. Okay? So now you have to remember that in sensory pattern, either the function is hypofunctioning or hyperfunctioning. In autism, all this functioning, all the 7 senses that we have, it can be hyper or hypofunctioning. And based on these hypo and hyperfunctioning, you choose the rubrics of the repertoire. Okay? So we can quickly go through the rubrics. Some children like to be caressed, some children like to be kissed, some children like to be caressed and kissed, cuddled. Some children, they don't want to be touched. These are the hypofunctioning and hyperfunctioning of the group. And therefore we have the remedies where caressing children they like, or even they don't like to be touched. So on 2 varieties you have got 2 spectrums here, right? Again, some children like belladonna, which is one of the commonest remedy I have seen, they'll come and play like this, noise. So noise inclined to make becomes a very, very important symptom. While some children, even with the slightest noise, they'll put hands on their ears. So you'll have hypofunctioning or hyperfunctioning. Okay? This is the kinetic or motor pattern, which is hyperactivity, impulsivity. There is always a ADHD component in autism, remember. And many a times we have seen that when we are healing autism, slow components of ADHD start coming. And then the child becomes okay. So many a times the mother will tell you that he wasn't like that, he's become hyperactive. And we know that some parts of ADHD are also there in autism, remember. Okay? Self-injurious autism. Children hitting their heads on the back, children injuring themselves, children biting themselves. Remember remedies like lysinum. Lysinum is a very, very important remedy for self-injurious behavior. Regressive pattern, as I told you, IOSMS, Bufo, Baritaka. Okay? So this is some of the patterns that I have done, and I have found out that if you have a sensory predominant pattern, these are the remedies. If kinetic, these are the remedies, self-injurious and regressive. So this makes us very, it's an easy thing, not that one of the pattern will come always to you, they will be all mixed pattern, but there will be one predominant pattern, remember that. Okay? This is a homeopathic case taking, as I have told you, major events. Remember the time of regression. The mother always tells you that my child was developing normally up to 2 years. He started saying mama, papa, mama, but at some point he started regressing back. That point is very, very important for us as homeopaths. We have to go back to our repertory, find out ailments from maybe death of a pet, or maybe change of a house, change of a school, Father went away abroad. Nobody at home. He was left alone with a servant or maybe a caretaker, and the caretaker, there was some kind of abuse. She did not feed him properly. All these things can cause regression, remember that. And these are the things that we'll take as ailments from, remember, okay? So we'll just look at a case called Mikhail. He came up with light को कम कर दीजिए सर लाइट वहाँ पे कर दिया So this was a case of Mikhail jumping on the sofa. This is the kind of course he's not very hyperactive, it's like a mild autism, but he's always jumping on the pillow, remember, which again tells us that there is some kind of cautiousness. A child of tarantula, a child like this will jump on the pillow and save himself, remember that. Even if he's banging his head, he'll keep his hand like this and bang, remember. While a case of Moscus would be absolutely violent and in a frenzy, he will jump and injure himself. Tarantula will never injure himself, remember that. That's a very important question that you have to ask the mother. That he's jumping, he's falling here and there, he's throwing things. Is he injuring himself? And the mother would 99% tell you that no, he takes care of himself. So it's all about a feigning thing in tarantula, while Moscus is absolute frenzy, remember that, okay? So Mikhail Costa, male, 2021, 3 years, 9 months. The mother's verbatim, my pregnancy was good till 7 months. Again, there is a regression here. In between 7th month, baby movement I could not feel. This is again a very, very important event. Admitted, I got delivered because of the cord was around the baby's neck. Again, there is a hypoxia here. About Mikhail, he has anger issues, gets angry if anything he's doing does not happen, bangs his head, likes playing with toys, cars, buses, singing rhymes, always singing songs, remember. He's not able to talk properly, but whatever he learns, he sings properly. So singing is there in him. He likes dancing, looking at the mirror, making faces. While we take him out for a party or any place, he only wants to run, run, run. He doesn't eat anything. Very close to my brother and his dad. Pulls hairs of other kids. So pulling hair is there. Liking music, dancing is there. Liking car and bike. Goes every day for a round with my bro. Likes cakes, biscuit, rice. Likes dancing, looking in the mirror. Makes faces. Now this is very, very important. There was a video I'll show you that is making faces. So there is a rubric called antics plays, remember that. It's a very, very important rubric that we can take in autistic kids. So antics playing is a very, very important. Current issues are no speech, no eye contact, does not sit in one place. So this is one important question that we ask to all the mothers of autism, because they'll rattle out all the symptoms of autism. But we as homeopaths need to know what is important. Because symptoms of autism are not the way we are going to prescribe. We are going to prescribe him something other than autism. So ask the mother, tell me something other than autism. Don't tell me what is autism. Because she knows autism more than you. Because she's gone to so many doctors and psychologists. She will teach you autism. But we don't want to learn autism. We want to learn the person. So we ask him as a person, right? So these were his totality. Banging his head, pulling hair, throws thing, no eye contact, does not sit in one place. Sitting tolerance is not there, likes to play drums, likes to make noise. Mikhail was referred to psychodiagnostic, where the psychologist said inconsistent eye contact, inadequate name recall, suggesting challenges in social engagement and responsiveness. Verbal communication and two-way interactions are below. All these are typical of all psychological reports. Remember, all psychological reports are like that. They teach you everything about autism. I mean, if you read a psychological report, you don't need to read any book on autism. Social skills are delayed. So childhood autism rating scale CARS 2 ST was done, and she said that it is 32.5, which is a very highly. It's like around a moderate autism. 32.5, it states mild to moderate symptoms of autism spectrum. This was by repertorial analysis, playful. He was always playing, remember, always doing something or another, even with the paper, even with the handkerchief. Does not need anybody to play with. That's playful. Jumping, climbing, restless, pulling hair, throws things. Absolutely simple prescription. This is what I wanted to tell you. That we don't have to really go to any hi-fi remedy or a remedy not known. We can find belladonna, bryonia, aconite. These remedies also can help us in autism if we come to the right diagnosis. Right? Imitation mimicry was there. Noise inclined to head, striking head, smiling. We found out that the rubrics covered were with belladonna in all playful, restlessness, striking, throwing things, traveling desire for climbing, jumping, noise inclined to make. First prescription I prescribed him LM1, that's the 15 milliliters of potency, twice a day for 15 days, followed by placebo for 15 days. Within 15 days, we received positive response from the mother that the speech and eye contact is more than last time. She said 40%. Sitting tolerance improved 50%. Head banging is 50% better. Jumping is less, but he always wants to climb. Speech with us is not so much, but he asks for food, water, biscuits. Keeps on singing songs, screams loudly, likes any toy stand. Second follow-up, again, radionim LM2, because that's what I do with LMs. Once the child starts responding, I increase the potency. If the response is good, you might even jump the LM potency. You can go from LM1 to LM3 or LM3 to LM5 also. Head banging is 75%. Can now tell about toilet. Now this is the important thing. The child was passing stool just like that, passing the diapers, not letting the mom know that she is passing stool. He started. So Belladonna LM2 again twice a day. The third follow-up, speech and eye contact better, head banging better, singing songs occasionally, toilet trained now. So Belladonna LM3. Now patient is still under my care, we are following up. Now psychological test was done on the 9th of October where she said that the waiting has increased to 32 seconds. Now they look at the sitting tolerance of 32 seconds, which was not even 5 or 10 seconds. Giving good eye contact, imitation task was playful throughout the session. Mikhail was cooperative, listening to instructions, increased to 35 seconds. These were the initial concerns of the mother and the psychologist. The mother now reports today significant reduction in head banging, aggressive behaviors, decrease in excessive jumping, sitting tolerance is better. Primary area still remains in speech. Now speech is a little bit not there. This is the cards. Now remember old score and new score. The current score is 25 reflected. So this is very, very important because many a times we as homeopaths look as only the qualitative aspect, but these things are important. Now today I am on a dais internationally talking to some people. We have international homeopaths, we have national homeopaths. There this quantitative as well as qualitative is very, very important. You can't just say that child hasna shuru ho gaya, eye contact theek ho gaya. No, not like that. Compare it with a qualitative aspect also, quantitative aspect. So we'll look at the mother quickly.
हाँ मैं ठीक हूँ हाँ हाँ हाँ
You can put this, no?
माम बोलता है फूड के लिए और फिर जैसे मतलब वन वर्ड में वो सब बोल लेता है जो भी है नो बोलता है यस बोलता है ऐसे आप बोलेगा ऐसे डाउन बोलेगा वो सब बोलता है लेकिन फिर ज्यादा कॉन्वर्सेशन नहीं करता है वन थिंग एंड हाइपरनेस उसका तो बहुत कम ही है लेकिन ऐसे अचानक दिन में कभी एक बार भी हुआ तो बहुत छूट होता है नहीं तो होता ही नहीं है ऐसा जैसे हेड बैंगिंग करता था तो वो करता नहीं है लेकिन ऐसे थोड़ा भी उसको कुछ मतलब कुछ नहीं भी हुआ है और उस दिन मुझे ऐसे देखा और ऐसे कर रहा था ऐसे कर रहा था और फिर वो कभी भी हंसता है तो आई फील ही इज डूइंग पर्पसली ऐसे नाउ आल्सो आई एम टॉकिंग टू यू तो ही नोज आई एम टॉकिंग अबाउट हिम नो ही सिट्स एंड ही लिसन्स एंड ही स्माइल्स वो बैक कैमरा करके मैं आपको ये कर दिखाती हूँ ये देखो मिकाइल
हेलो मिकाइल हाउ आर यू
मिकाइल सी नहीं उसको नहीं सुनाई दे रहा मैंने ईयरफोन डाला है हाँ
So with the mother also it is important. You take a test. Exact thing. The mother is the best doctor. Remember that. More than you, more than anybody else. Taking from mother and of course second from the teacher, because the children spend most of their time at school. So a parent-teacher meeting or the teacher herself can be a very, very good source of. Then we talked with the psychologist. She's also told us about.
Is it in English?
Yeah.
Hello everyone. So I'm Dwani. I'm a practicing psychologist. It was truly an honor to work with Dr. Sameer on this case, where we met a 4-year-old child who was diagnosed with moderate autism. He had concerns in the areas of social engagement, communication, sensory overload, and as well as emotional regulation. So, Dr. Sameer saw this case in the homeopathic sense, and the child started receiving regular ABA therapy from our side. So, in a very short span of time, the child showed a lot of improvement in all of these areas, which was quantified on the basis of the CAST to ST score. And at the same time, the clinical observation. And we received regular feedback from his mother that how she sees an improvement in it. So this is truly a sign that how homeopathy and psychology can work together to bring out a holistic improvement.
Okay, so that's how I think it's a team effort. Remember that we have to have a team of a psychologist, even a psychiatrist, a counselor, occupational therapist, a speech therapist. All these people have to work together when we have to deal with it. So it's not only the homeopath who can do it. We'll have to have the help of other therapists also, which is very, very important. So it's a teamwork, it's a synergy. So this is what I wanted to just convey to you. It's a very short thing today. It's a whole seminar of 2-3 days. But what is most important is common remedies like belladonna, opium, even natramute, silica, they can come. Carcinosin is one of the most important remedies. Phosphorus, lachesis. We have umpteen numbers of our polycrests who can really work. Of course, there are rarer remedies and we should think of rarer remedies also. But we have our remedies at our disposal which we can really use during autism. Okay? Thank you very much.
Very good, doctor. Very good. I'm very much impressed. Sharma ji, camera le jara photo ho jaye hero naal. Laura, come here.
Sharma
You come here.
Doctor sir.
1 minute more. Laura, please come.
Your wife is on.
It's okay. Today is okay. Sunita, you come here. Come here. Come here.
His wife.
Actually, yeah.
Yeah, okay. Yeah.
Come here.
Sir, your phone is ringing.
Yeah, it's my fault.
चेहरे पे लाइट तो नहीं आ रही भैया? ये वाली
नहीं, आंखों में लाइट आ रही है.
आ रही है क्या?
Thank you, thank you.
थैंक यू. मुझे तो जाना नहीं अभी.
नहीं आ रही है, सीधा जा रही स्क्रीन पे. इधर हो जाओ.
हो गया? Dr. Saurabh Arora, please come. We are waiting you since morning. So, thank you, Dr. Chokar, for your very good lecture. He is banned today's event. So, what I am telling you now, please listen carefully. We are postponing 2 lectures after the lunch because you are hungry. These people are very ready 1 o'clock. So please all go for the lunch. And after the lunch, please come here. We don't want calling you, come on. You have to be here before 2 o'clock, definitely. The next lecture will be from Dr. Shafali from India, Maharashtra, Ambernath. So take lunch. Honestly, you will enjoy her lecture as well. Thank you very much.
After lunch.
Please be kind by 2 o'clock. Let's follow the rules. Come by 2 o'clock so that all the
I'm going to give it now 10 minutes. There's so many.
Dr. Geeta.
फिर आपका कौन
sumptuous meal that we had. So what I'm presenting today in front of you all is actually a study, a research work that I did under my PhD program. So this paper is under publication, and to present it here, I have actually called it From Deficiency to Disorder. This is a paper presentation under publication of research work done by Dr. Vasundhara, that's me, under the supervision of Dr. Sonia Tuteja, she is my guide. And she's also the PhD coordinator of Homeopathy University, Jaipur. I am faculty of Solan Homeopathic Medical College, Himachal Pradesh, and also a research scholar at the same university. So as the actual title of my study is an exploratory study to assess the role of homeopathic medicine, Calcarea carbonica, in the management of vitamin D insufficiency. So here is a presentation. So to begin with, obviously we need to talk a little bit about the understanding of nutrition and deficiency disorders. Basically, we all know what are deficiencies, but there is something deeper lies within the core of each and every deficiency disorder, which, if left untreated, goes on to proceed into like any n number of chronic ailments that we have already seen since the morning today. So understanding nutritional deficiency, there are essential nutrient overview we see, then there are 6 main macronutrients that we all know: protein, carbohydrates, fats, vitamins, etc. Then there are micro 30 elements. 30 elements on which this whole study is has been, it's an exploratory study which is peeping into the role play of these micro 30 elements. One of those elements is the basic intervention that I have used in this study. So I would like to mention something about these 30 elements. There is a chapter, Sora or Deficiency, in Dr. Herbert Roberts' Principles and Art of Cure by Homeopathy, which talks about the principal antisoric medicines laid down in Bonninghausen's repertory of antisorics. So out of those 50 antisoric drugs, 16 were plant remedies, 1 was sepia, and the remaining 33 were from mineral kingdom. The 33 number reflects to the micro 30 elements we are talking about here, micro deficiencies leading to the symptomatology we have recorded in our Materia Medicas. The types of deficiency when we talk about, they are primary, secondary, and then conditional. Primary, obviously because of inadequate, insufficient intake of proper diet. Secondary, because of certain malabsorption syndromes. And the third one is conditional, like there is a condition of pregnancy, or like there is a growth spurt, there's a growth phase of children, and during that time they require more of the nutrients which actually fall short, and the person may develop some sorts of symptoms of deficiencies. So talking about the topic, vitamin D, the sunshine vitamin, we all know that the key functions are into calcium and phosphate metabolism, immune system modulation, cardiovascular function regulation, cellular growth control, neuromuscular integrity. Let me tell you this thing, vitamin D, that is so very prominently, it is coming up as a deficient nutrient in most of the people all over the world. So the main problem is this, that it acts as a hormone also while being a vitamin. Hormone which sits on the gateway, like a guard, gateway of the cellular activities at the genetic level, regulating how and what the basic chemical processes, biochemical processes inside the cell will go on ahead. So vitamin D metabolism pathway. The first layer is skin. We all know skin, or the gut also. The gut means the diet, where we take in ergocalciferol or cholecalciferol. Under the skin, 7-dehydrocholesterol gets changed into vitamin D3, that is cholecalciferol, and vitamin D3 is then enters into the blood circulation, moves on to the liver, where it is changed into the storage form, that is 25-hydroxy vitamin D through a process of hydroxylation. Then from there it moves on to the kidney, where it again goes on into a next level of hydroxylation, that is 125 hydroxyl 25 D, vitamin D, and then from there out of the kidney, when it reaches into the circulation, it reaches the target tissues, wherein it helps into calcium absorption. Percent population have levels below optimal, that is 30. That means you are not clinically deficient, but you are trending towards a deficient state, which needs to be checked at a much earlier level. So what insufficient means clinically? Obviously, the patient may not be very much aware of the state developing into the system, but may complain of increased body pains most of the times, then weakness, then recurrent infections, then hair fall, then developing other kind of every now and then they say they tend to fall. So falling tendency increases because there is a stiffness in the musculature of the body. Why the muscles tend to protect the bones from breaking, because bones are very fragile when they are deficient with vitamin D. So high risk population are the elderly, the children, people with darker skin, institutionalized individuals. That's what the work culture nowadays we have. 9 to 5 we are into our offices. 8 a.m. to 10 a.m. is the peak time when the ultraviolet rays of the sun, the most beneficent ultraviolet rays of the sun, can be absorbed and can be processed into vitamin D. Current standard approach, direct supplementation is the current standard approach. Food fortification, recommended doses are 400 to 2000 international unit daily, depending on the age and condition. So here comes the 012 and 25.92 nanogram per ml at 8 months, P value 0.0001. That was highly significant. Overall treatment significance was verified by repeated measures in analysis, that is the analysis of variance and over test. Participants over 30 years old showed an improved response in comparison to the younger ones, and according to the age stratified analysis. The inclusion criteria: 18 years and above, laboratory confirmed serum 25 hydroxy levels below 30 nanogram per ml, ability to provide informed consent, and willingness to attend follow-up assessments. The exclusion criteria is to be considered, to be paid more attention to, because we did not include any one who was pregnant or lactating, who had known hypersensitivity to ultraviolet radiation, diagnosed thyroid disorders, current use of vitamin D supplementation almost 2 to 3 months before and after the study. Then malabsorption syndromes or gastrointestinal disorders like Crohn's disease, ulcerative colitis, or anything of that sort was not taken into consideration. Then chronic kidney or liver disease, use of medications affecting vitamin D metabolism. So intervention protocol was calcarea carbonica in centesimal potency. Starting potency was taken as 30. I planned that I would raise it to 200 or 1 m if required, but it was not required at all. 30 potency was carried forward throughout the study itself. So this is the gender distribution: female 23, male 8, that is 74% or 74.2% were female, 25.8% were male. Similarly, greater than equal to 30 years were 22 participants, and less than, greater than 30 years was 22 participants who were enrolled. You can see the third reading of some participants was not received. So they they withdrew from the study in between, because that was given in the that they can withdraw if there is any sort of discomfort or any problem during the entire course of the study. So this is the statistical analysis. I did a Kolmogorov-Smirnov normality check to find if the data was normally distributed. So that was normally distributed. We did pair t-test to actually compare two values, like baseline to 3 months or baseline to 8 months. So we saw that baseline to 3 months was not that very significant, but we saw great huge improvement from baseline to 8 months. That was P at 0.0001. Independent t-tests were conducted to compare different. It was taken, and this analysis is done when we have multiple readings. Like there is not a simple pre-test post-test. We have multiple readings, like at baseline, at 3 months, at 8 months. We had 3 groups of reading. We did analysis of variance, and analysis of variance showed partial n square, that is eta, 0.22. That is not a moderate effect. Actually, it is a large effect size of the study. So vitamin D levels definitely changed over time. So we did chi-square test also. So no weird patterns in who was in which age or gender group. So thank you.
Very good, very good, very good.
Yes.
Just a minute. Oh, I'm not wearing glasses. Vasundhara. You know what Vasundhara means?
Yes, sir.
The earth. Yes. The whole earth. Oh, because Dr. Geeta Chandani oh, she is there. She came last. Thank you very much, Dr. Vasundhara. I really enjoyed. Everybody enjoyed? Good. Thank you. Dr. Ratan Kumar Roy from Roy. Roys are very important homeopaths in India, from Bengal. Okay, Dr. Roy, welcome. Dr. Sameer, help him.
And the assistant respected Dr. Sameer Chowkar, who is helping to this conference. I am not giving a theoretical discussion because you are all doctors. You have gotten theory from when you have practiced, when you are in college. So I am not discussing about my theory of the disease of theory. Everybody knows the theory is a books writing, but I am sharing a practical knowledge from anorectal disease. I am a Dr. Ratan Kumar Roy from Delhi, India. I am a practitioner, anorectal physician. I am not a surgeon. I treat the patient for of the anorectal area, which we suffer from a long time, and most of the people nowadays are suffering from piles, fissure, fistula. Even the children also suffering from anorectal disease. That is, children are suffering from homeopathy is very better remedies, and we have to necessary to grow the homeopathy practice and to follow Hahnemann's. Thank you. I am not telling anything without it. Thanks.
Thank you, Dr. Roy, for an enlightening lecture on piles, fissures, and fistula. So now let me invite Dr. Shefali Rathod from Mumbai, India. She'll be talking on a case of urinary tract infection.
Myself, Dr. Shefali Rathod from Mumbai, India. I'm practicing since 2008, but I do practice homeopathic plus allopathic also. So general practice also with homeopathy, but I get so many cases that some people come do for homeopathy. You give me homeopathic, like. Now, I'm going to talk today about a case of urinary tract infection. First, we'll know what is urinary tract infection. It is the most common disorder seen in females. Right in India to anywhere in the world you see. So many cases of urinary tract infection you get nowadays. Because in India it's pure hygienic. Then in female it is more commonly executed, like I may say, each 10 out of 2 females will be having UTI in presence. Maybe she is a young lady or an old lady, but she is going to get UTI in some of her this life once. So today we'll talk about it. What is urinary tract infection? Freshly passed urine is regarded evidence of UTI. There are some predisposing factors, like it is mostly common in female, in pregnancy, after sexual intercourse. Then the second one is failure of complete bladder emptying, prostatic obstruction, neuropathic bladder, stones. You've got papillary necrosis, diabetes mellitus, analgesic nephropathy, sickle cell disease, then polycystic kidneys, vesicoureteric reflex, infrequent, incomplete voiding, bladder catheterization. So many factors are responsible for all this. So what are the organisms responsible for urinary tract infections are Escherichia coli, the most commonly seen organisms. If you do a urine culture, whenever after the blood test and urine routine culture, you will see this is the most bacterial organism which is affecting UTI. The second one is Staphylococci, third Enterococci, the fourth is Klebsiella, Pseudomonas, then the fifth is M. tuberculosis. Now, what are the clinical features you get in urinary tract infection? First of all, you will get sudden onset of fever with rigors. So there is fever which is coming suddenly. Then you've got pallor, malaise. You may have even nausea and vomiting associated with it. Then you've got pain, tenderness in the loins, flanks. So many different symptoms every individual gives. Females will have abdomen pain quite frequently in UTI. So there are 2 types of urinary tract infection. One is the acute one. The second is the chronic one. Acute will be like it is coming suddenly and it will be for some days. But the chronic infection is coming and it is recurrently for many weeks because the patient is on allopathic. Lot of time doctors prescribe allopathic and most of them are the 4th generation antibiotics like cefixime. Then you've got nitrofurantoin, you give amoxicillin which have got marked side effects. Like
Thank you, Dr. Shefali. Excellent presentation. May I call Dr. Singhal from Chandigarh, India. He will be presenting a case of osteomyelitis and his approach to osteomyelitis.
So all are awake?
Yes.
Fired up? Okay. So I am going to present a case of bone infection. This is a serious bone infection, and this case was treated for long years, 4 years. I treated the case for 4 years, and now the patient is totally normal with only homeopathic medicines, no allopathic medicines, no allopathic intervention of medicines. This is purely a surgical case. So this was a very challenging case and denied case from Dibrugarh Medical College, and they advised the patient to just cut the leg. So patient was having infection in the left thigh, femur bone was infected, and in routine by orthopedic surgeon. Seems to be tedious case, isn't it? Interesting with homeopathy. So let's start. osteomyelitis. How many of you have already heard this term? You can raise your hands. Yeah, osteomyelitis. Osteomyelitis. Osteos and myelitis. Osteos means bone. Myelos means bone marrow. So bone marrow infection. And this is a serious bone infection where orthopedic surgeons also, they are much afraid to treat such cases. And in homeopathy, this is the scope of homeopathy actually, what I want to show you. So you can go through the details. I'm not going to go in further details about this pus discharge. Everything was there. From the thigh bone, left femur was infected. This case report describes a boy with post-operative chronic osteomyelitis of the left femur, meaning the infection of the thigh bone. Following the fixation surgery, I'll show you all the pics with the fixator and everything that was installed by orthopedic surgeon, and after few years he was advised for complete amputation of the leg. And here comes the role of homeopathy. This was infection of the thigh bone following fixation surgery, who was successfully treated with us with individualized homeopathic medicine. And this case was diagnosed in 2019, and he had a non-healing sinus, greenish yellow pus discharge, recurrent fevers, and risk of immobility. Treatment followed classical homeopathic principles using the totality of symptoms, all complaints considered together, the miasmatic background, inherited disease tendencies, and repertorization. Systematic matching of the symptoms with the remedies. He was given Calcarea carbonicum. Can we expect such a wonderful medicine? How wonderful Calcarea carb is the medicine? Madam has already told you about the Calcarea carb in vitamin D. So we have a great scope of homeopathy, right? And then we also use silica and sulfur as an intercurrent remedy as per the symptoms need. Over the time, his pain and appetite and general health improved as we study in the books, right? But this is a marvelous case, because this case was right from 2019 until the date. I am following this. Patient is still with me. Improved the discharge, reduced, sinus healed, mobility returned. By April 2025, he achieved complete clinical and radiological recovery with no relapse during 1 year of follow-up of treatment. This case suggests a potential role of individualized homeopathy in chronic osteomyelitis, encouraging integration of complementary and conventional care. So yes, myself is a classical homeopathic practitioner for over 23 years of practice now, and I am based in Chandigarh, India.
Which province you gave, Dr. Singhal?
I'll just come over it. So this is the case summary I have already discussed. I'll share this prescription with Dr. Sharma and whoever wants to study, and he can go through that. And also I am going to publish this study to CCRH. I have already sent the email for that. And more so, I am a bone infection specialist, you can say, with homeopathic medicines for the first time in India, and with more than 100 cured cases in my own name, with proper documents in last 20 years. So first of all, patient was 19 years old. Patient is at present 19-year-old at the time of diagnosis. Boy from Tinsukia, Assam, India, who underwent a surgical fixation of his femur bone of the left leg, and limb reconstruction surgery was done. That is, a nailing and plating was not removed on time, and this led to the development of infection in the surrounding tissues and then to the bone. On 23rd April 2019, the patient was diagnosed with chronic osteomyelitis in the femur bone at Assam Medical College and Hospital, Dibrugarh, Assam. These were the findings. You can go for this. Patient was presented the following symptoms: oozing non-healing wound, swelling around the area with the railings and platings, severe pain in the left leg. First consultation with us. They first approached us on 29th October 2020, and the first batch of medicine was sent to the patient. This is a purely online case. I have never seen a patient even once in my clinic. This is purely an online case. Through video call, we have prescribed the medicine and we have sent the medicine through post. So after taking the complete case and the generalities and everything, so mental generals were there, oversensitivity to all external impression because that boy was very timid, and after getting such type of fracture and after lying down for a longer period of time, anyone can have some disappointment and despair of recovery. These are normal general symptoms which one may ignore. But this is the most important thing. Despair of recovery, leukophlegmatic temperament, sorry constitution, and then physical generals, boiled eggs, desire for, you might have heard, Calcarea carbonicum, aggravation from mushrooms and eggs, meat desire, must have meat. He was having a craving of this fish as well as chicken. So we adopted the classical homeopathic approach and aimed the treatment to reduce acute symptoms first of all, and then to stop further necrosis of the bone and then the surrounding tissue and promote the bone health recovery and strengthen the patient's immune system. After detailed case analysis and repertorization of the patient on 29th October 2020, using the Synergy homeopathic software, the repertorization chart is indicated. Calcarea carb, you can go for it. Bone osteomyelitis, generalities, abscess, suppuration of the bones, generalities, abscess, suppuration of deep muscles, coldness of the affected part. This is the second repertorization chart showing the similibum medicine as Calcarea carb, but the next medicine is silica. So first of all we used Calcarea carbonicum. Monarch score, this is the latest technology, Dr. Samir might be knowing everything about Monarch. So this is the international standards to give medicine. Patient was not improving at all, no visible changes even after Calcarea carb 200. Most important thing in such type of cases, most important thing is patient was getting better. His fever was coming down. His generalities were improving. Patient was feeling good appetite. After 6 months of treatment, now you can check. Wound is as such. Non-healing wound is there, lateral compartment of thigh swelling. Every symptom is just same. But now the pus quantity has decreased. Pus color is now greenish color of pus. That has gone. So Pseudomonas bacteria, that is gone. Pseudomonas bacteria give rise to green color of the pus. So Calcarea carb 1M, again we again increased the potency of the medicine. Now 2023, patient is feeling better in terms of pus quantity results. You just check the results. Patient is feeling better in terms of pus quantity as well as quality. Pain is reduced by 80%. No painkillers. Appetite improved, thriving well, significant reduction in pus. Reduction, and as of 28th August 2023, patient started walking with the support of walker. Now, 30th October 2023, patient is feeling better in terms of pus quantity, pain is reduced again, and patient feels more optimistic while continuing working with the support of walker. Then 2023, December 2023, patient feels more optimistic. And now, the last 4th March 2024, pus discharge completely stopped, cloaca completely closed, but now we have given silica 10M in between. And now patient has completely healed. Patient started walking normally and also started cycling. This is pure homeopathy, classical homeopathy, my dear. No allopathic intervention, no medicines in between. This is the condition of the patient at present, last year. So patient come with this condition in 2020, and now in 2024 patient is having normal leg, normal thigh. This leg was not saved, this boy was saved actually. Now he is a fan of homeopathy. His family is a fan of homeopathy. They have paid me a very meager amount of money. But what I felt is I have saved one life. So you can. Patient was again reviewed for continuously for 12 months. I will take 2 more minutes. Without any medical intervention and found out to be completely well. And this was the sugar of milk and supplements, vitamin D3 were given. No diet restriction. I have ordered him to just have meat as much as he want. No restrictions, no onions, no garlic, no restrictions. You can eat garlic as well as onion, you can have coffee, you can have tea, you can eat everything. Because now he has improved a lot. Sir, can you help me with the email? So by June 2023, the first discharge has... So sinus tract, bone degeneration, we are having more than 100 cases of documented cases basically for osteomyelitis in last 23 years of my practice. In fact, I have my thesis project in 2003 in fact only on osteomyelitis. Right? These are very difficult cases to cure, especially the surgical case.
हाय, मेरा नाम निरंजन निशन, मैं तिनसुकिया आसाम तिनसुकिया डिस्ट्रिक्ट के जागुन से हूँ। पहले लेफ्ट हिमा में मेरा थोड़ा पेन स्टार्ट हुआ था और डॉक्टर भी क्या बीमारी हो रहा है कुछ पता नहीं चल रहा था। 3 months के बाद जब मेरा एक्सरे किया तब मालूम पड़ा कि मेरा बोन में इन्फेक्शन स्टार्ट हो रहा है और डिब्रूगढ़ में मेरा एडमिट किया गया। उसके बाद डिब्रूगढ़ में एडमिट करने के बाद मेरा MRI किया। MRI में मालूम पड़ा कि मेरा बोन में जो है इन्फेक्शन स्टार्ट हो रहा है और ये रहा डिब्रूगढ़ हॉस्पिटल का MRI रिपोर्ट। MRI रिपोर्ट में यहाँ क्लियरली लिखा हुआ है कि ऑस्टियोमाइलिटिस हो रहा है। और जब मेरा ऑस्टियोमाइलिटिस का बीमार हो रहा था तभी बीच में गिर के मेरा बोन फ्रैक्चर हो गया। फ्रैक्चर होने के बाद बोन जो है ज्वाइन होने के लिए थोड़ा दिक्कत हो रहा था क्योंकि मेरा बोन में इन्फेक्शन कुछ ज्यादा ही हो रहा था। तो यूट्यूब पे मेरा मम्मी ने वो वीडियो सर्च किया कि ऑस्टियोमाइलिटिस, पहले सुना नहीं था कि ये वीडियो में मालूम पड़ा ऑस्टियोमाइलिटिस होता क्या है। उसके बारे में जानने के लिए जब सर्च किया तभी डॉक्टर विकास सिंह सर का वीडियो भी मिला। वीडियो में बोल रहा था कि वो ऑस्टियोमाइलिटिस ठीक कर सकते हैं और उसका इलाज भी होता है। एलोपैथिक में थोड़ा दिक्कत होता है क्योंकि एलोपैथिक पे एग्जैक्टली मेरा बोन जो है ज्वाइन नहीं कर पाया। तो यूट्यूब पे सर्च करने के बाद जब क्या बोलते हैं रिपोर्ट मांगा, एक्सरे का रिपोर्ट दे दिया और ये हॉस्पिटल का जो है रिपोर्ट भी सब दे दिया। फिर मेरा उनके साथ कभी भी पर्सनली बातचीत किया नहीं, सब ऑनलाइन पे हुआ, सब फोन से उनके साथ कांटेक्ट किया गया, सब बातचीत किया। फिर पोस्ट ऑफिस के द्वारा मेरा मेडिसिन जो है सब पोस्ट ऑफिस के द्वारा भेजा। पहले ये रहा 2019 में हुआ था, ये स्टार्ट हुआ था। 2019 तक तो मैंने एलोपैथिक लिया था, लेकिन 2020 में मैं फर्स्ट ये स्टार्ट किया। ये था डाइटिंग लिस्ट। फर्स्ट ऑफ ऑल डाइटिंग लिस्ट मेंटेन करने के लिए बोला था और टीवी मोबाइल वो यूज करने के लिए थोड़ा कमती करने के लिए बोला था और ऑर्गेनिक फ्रूट्स वेजिटेबल्स वो सब लेने के लिए बोला। फिर 2020 से स्टार्ट किया, 2024 तक कंप्लीटली मेडिसिन लिया। मेडिसिन लेने के बाद मेरा एक सेकेंड पेट भी दिखा देता हूँ मुझे। ऑपरेशन भी किया गया था मेरा हॉस्पिटल में। यहाँ से खून भी निकला था थोड़ा थोड़ा, जो हड्डी का बचा हुआ जो टुकड़ा था वो भी निकलने लगा। मेडिसिन लेने के बाद सब निकल गया और 2024 तक कंप्लीट हो गया और साइकिल चलाया और चल भी सकता हूँ अभी, बिल्कुल ठीक हो चुका है।
वेरी गुड।
Thank you very much.
Thank you, Dr. Singhal. Very good case. Very good case.
very good evidence-based case from Dr. Ved Singhal, and many more he has. So,
from UTI in our country like India, Pakistan, Bangladesh, and what's the reason? It's my experience, my clinical experience, and my research base. That is the reason is our toilet.
Toilet, yes.
Yes, because we males are not using urinary pot, and we are urinate on the toilet seat, and the female directly sit on that seat and they get the infection from that seat. That's the only reason. I think most of we Indian, Pakistani and all these, we have only single toilet seat, not using urinal in our washroom. So you must install urinal pot in your washroom to protect the UTI infection. Thank you.
Yes, sir. Yes, sir. Discuss something about research. Am I audible to all? Yeah, perfect. Thank you. So my talk today is on effectiveness of homeopathy from research point of view. Now, why research point of view? Why effectiveness? Why we are concerned? We'll all try to learn in these next 20-25 minutes. So without further delay, let me start. Now, there are two things: efficacy and effectiveness. These are two basic terms we often heard, we often read in journals, on papers, that it is efficacious, it is effective. So what is the difference between efficacy and effectiveness? It is basically the challenge. If you show something in test tube, that is efficacy. But when we convert that efficacy into a real life scenario in a patient, that becomes effectiveness. So effectiveness comes with a challenge that the real life scenario can, if I am to simplify, whether the test result replicated or translated into real life clinical setting or not. So this is effectiveness. So we will talk about the effectiveness of homeopathy from research point of view. Now this effectiveness is basically a part of the translational research. You know what happened with research? I did a research and I kept that research into my pocket. Nobody's using that research. Nobody's translating that research into clinic. So what is the basic purpose of research? It is to give strength to the homeopathy and to replicate or use it in the clinic. Right? For example, Dr. Vasundhara was telling about calcarea carb in vitamin D deficiency. We did not publish that study, but we did one pilot study with calcarea fluor and phos in INMAS, okay, in 2008. So we had a research project in INMAS, and we did that research. It was not published. It was for the internal, some kind of understandings and all. We'll come to that part later. So basically, it's a translational research which we need to convert that test to the practice. No, why research point of view? We all are homeopaths. We are happy sitting in our clinics, seeing patient, earning money, doing consultation, talking to each other. Why research should be there? Why? Since research is boring, nobody bothers. Research is difficult. I've seen best of the people in homeopathy stopping research because it is difficult. It is inaccessible. It is costly. If from the people from India, they can, there is a scheme, the extramural research scheme, the government gives you 30 lakh of grant, but nobody takes that grant because it is too difficult, it is too inaccessible, it is too boring. So I'll try not to bore you today with research. So why establish the effectiveness? The answer to this question will come at the end. So I'll connect the dots at the end, why to establish the effectiveness. So if we move, then there are certain domains in research, the physical, physicochemical, biological, literary, clinical, and allied. If you just go to a website, researchinhomeopathy.org, I run that website for past, I think, 15 years now. So my purpose is not to, be the topmost researcher, but to convert that research into a translational value. So I'm going to do, so this is basically homeopathy, and we are getting confused with the high dilutions and homeopathy. Homeopathy is only the clinical application of high dilutions, and that is called homeopathy. So, for example, nowadays we are talking about veterinary, we are talking about the fundamental research, we are talking about dentistry, agro, and all allied things. So, this clinical application of high dilution is homeopathy. But broadly, they are called high dilutions. So, in research journals, if you see, they have stopped using word homeopathy. In fundamental research, if you go to PubMed, if you search high dilution, you will have the homeopathic studies, because that is high dilution. So I'll come to that part later. So why should I care about research or effectiveness? Again a question. I'm a clinician, I see patient. Why I am to worry what is going on in research? Now, again, this question would be answered in the end. Let's have some studies from different domains which showed the effectiveness of homeopathy, and that is being translated into today's scenario. So this was one of the study which I like the study. It was the information transfer. Whether the information is transferred from a system, from a homeopathic remedy to a system, because what we do, only take the dilution, give a stroke or a succussion, whether this information is transferred into the other system or not, and how. So they took, the dilutions were prepared and placed in a receiver solution. There was no touch. You can see the figure. So in the receiver solution, they kept a dilution and succussed from outside. And then what they did, they took out the receiver and the solution, and they evaluated the UV vis, NIR, that is ultraviolet, visual, infrared, near infrared spectrum, and they found the electrical conductivity, pH, and OH. Right? So the conclusion was that these high dilution signals were detected in the solution with varying pH levels. And the remedies were arnica, like the 3 potencies of arnica, 6, 13, 200. So now the crux. Now why I should worry about this study? Why? This was a highly, physical study, a fundamental study. How is it benefit to me? The benefit is that I have a confidence to show it to my allopathic friends, to show it to my scientists friend, to show it to my patients, to show it to the critics, to show it to the people who ask how the information is carried on or transferred in the homeopathic system of medicine. So this study gives me that confidence, right? Further, the second study, the homeopathic dilutions or simple dilution. Now this is what we are challenged with. People say all the dilution looks same. Are they different? In your clinic, if 100 remedies are kept, or suppose in my clinic, I have around 350 medicines displayed in rack. So people say, sir, everything looks the same. They all are liquid. So theoretically, if the dilutions are nothing and identical to the vehicle, there should be no difference at all. Because if they say no difference, nothing, homeopathy doesn't work. But the study proved the opposite. So what they did, they took the cuprometallicum, our favorite remedy for cramps, and it is at par with the rust ox. So the frequency they studied, it was from the 100 kilohertz to 1 megahertz, and the result was that potentized medicines that differ one another in the arrangement of vehicle molecules. So basically, they proved that it is not simple dilution. So once we give this succussion, once we subject that to potentization, there are some changes which are visible and appreciable changes. Now this study, what this study gave to me? The confidence. To study the physico-chemical properties. Okay, fine. You are using hypericum, we don't mind. Let us try to take that hypericum into a lab. Let us subject it to the highly sophisticated instruments, and let's see what's there inside. So this is a study for us, not for them. So micro nanoparticles in colloidal form in all potencies derived from trituration or extraction origin were present. Now, what this study gave to me, the confidence that yes, whatever I'm using in my clinic, thinking that this hypericum goes to the tissue, have these changes, does like this, but what is the mode of action? what exactly is acting from that hypericum tincture or low potency at a physiological level. So that is the nanoparticle, and particularly that is the colloidal form of that nanoparticle, which is acting at such a subcellular level, right? So homeopathy exists even at nanostructure level. So this line, I like these lines. You know why? Because whenever a critic, ping us online on social media, write an email, I told them, okay, fine, this exists. Why? I'm not saying, the research is saying. So what does potentization do? Anyone? We all are homeopaths, fan of potentization. What does potentization do? Just think I'll grab a sip of water. Anyone? Potentization, what does it do? Only a fancy way of making medicine? I got a comment, nobody knows. We all know, right? So it's not a fancy technique that we use in our clinics. Okay, fine, take a remedy, tuck, with potentize, give it, take it. So what does it actually does? So this study, the team explored the physicochemical changes induced by the potentization in cupric oxide and zinc oxide nanoparticles in dilutions up to 6 CH. So these dilutions, they made it till 6, which is like standard potency. And they were subjected to fluid motion, X-rays, photoelectron spectroscopy, FTIR, that is Fourier transformation. Efficacy has to offer us. So I'll conclude this with trust, reach, replicability, authenticity, scientificity, and unbiasedness. So thank you so much for your time.
Saurabh, please come here.
Sir.
Really good lecture. How many of you liked it? How many?
Don't raise hand.
And I tell you something very special. As I'm growing with age, he will be the new college administrator, principal, director, everyone. Please welcome him. Thank you. Sunny Saab, please come. Your dad. Thank you.
Thank you, sir.
I'm retiring, I'm going to Himalayas.
Sir, we'll go along.
Thank you.
Sir, for giving me this opportunity and my better half for supporting me. I would like to start my topic, hypothyroidism. This actually we have published this in UGC conference. Now I am going to start about hypothyroidism. I would like to thank my teacher, Dr. Adil Chimtanawala, and my guide, Dr. S. Sabari Rajan sir, for guiding me throughout the study. Now coming to the thyroid gland. So this is a thyroid gland, and this is the anterior part, and the posterior part we have a parathyroid gland. Thyroid gland will be secreting thyroid hormones, and the C cells which are present in the thyroid gland will be secreting calcitonin. And this calcitonin will be counteracting the calcium metabolism with the parath hormone. So now coming to the thyroid gland, whenever in our blood, when there is a low thyroid gland like T3 and T4, the hypothalamus will be sensing this T3 and T4 hormones, and that will be releasing thyrotropin releasing hormone called TRH. So this TRH will be binding to the receptors present on the anterior pituitary, means thyrotrop cells, and that will be releasing TSH hormone into the blood. So the TSH hormone will go to the thyroid, and it reaches the follicular cells which are present within the thyroid gland, and it releases T3 and T4. So here coming to the follicular cell in the follicular cells. So this is one of the follicular cells. Here this follicular cell is having a basolateral side and an apical side. So besides the apical side, there is a colloid. So whenever we are taking iodine through diet, so this is a inorganic iodine. When we take inorganic iodine through diet, it will be going through from the blood vessel, it will be going into the follicular cell through a sodium iodine symporter. So whenever that inorganic iodine is going inside to the follicular cell, it is called as iodine trap. So this iodine will go outside to the colloid through a pendrin channel. Whenever this iodine goes out with the help of thyroid peroxidase, so it will change into an organic iodine. So that process is called as oxidation. This organic iodine will be binding to the receptors present on the thyroglobulin. So this thyroglobulin is a precursor for thyroid hormones. So this organic iodine will be binding to the receptors which are present on the thyroglobulin molecule, binding to the tyrosine residues. The process is called as iodination. So through this our thyroid molecules have been produced, T3 and T4. So this is the formation of the thyroglobulin. So whenever the iodine molecules bind to the thyroglobulin, tyrosine residues, if one iodine atom has been bound, it is called as monoiodotyrosine, and if two iodine atoms are bound, it is called as diiodotyrosine. This mechanism is called as coupling mechanism. So now again under thyroid peroxidase action, one MIT and one DIT will combine together to form a T3 molecule, and two DIT molecules will combine together to form T4. So T3 is a stable compound and it is having a half-life of 1 to 2 days, whereas T4 is an unstable and it is having a half-life of 6 days, 6 to 7 days. So this thyroid T3 and T4 molecules will be binding with the plasma proteins which are present in the blood with the help of thyroxine binding globulin. Rest of the thyroid hormones will be called as free T3 and free T4. So this free T3 will be converted into this free T4 will be converted into T3 with the help of 5-iodinase molecule. So this T3, when it changes from the T4, it binds to the thyroid hormone receptors which are present all over the body, and these are helpful for the regulation of the gene expression and maintaining of the metabolic and physiological effects throughout our body. So this 3,3 will speed up the cell basic metabolic rate, like it increases the cardiac output, it stimulates the bone resorption, it activates the sympathetic nervous system and also acts on the hair follicles, sweat glands and also sebaceous glands. And TRH will be high, TSH will be high, thyroid specific antibodies will be positive, free T3 and free T4 will be reduced. Whereas in the secondary hypothyroidism, here there may be any pituitary tumor. That's why TRH will be low, TSH will be low, thyroid specific antibodies may not be present, free T3 and free T4 will be reduced. So these are the interactions. If TSH, if it is high, so these are the different variations actually. So these are the clinical signs. What are the clinical signs actually? Elevated C-reactive protein, high prolactinemia, hyperprolactinemia, hyponatremia, increased creatinine kinase, increased LDL cholesterol, increased triglycerides, normocytic anemia, proteinuria, macroglossia, periorbital edema, pleural effusion and pericardial effusion. Why? Because of the deposition of glycosaminoglycans. So what is the treatment of choice in the modern medicine actually? Levothyroxine and liothyroxine. T3 is called Liotrix and T4 is called levothyroxine. So whenever this levothyroxine have been taken, these are some medications which interfere with the action of this levothyroxine. So these are some medications which interfere the action of levothyroxine. So in these cases, we have to increase the dose of levothyroxine. So what are the side effects of this treatment? So the patient will be if the patient have been taking for a long time for this thyroid medication, they will be experiencing osteoporosis and also worsen the diabetes control. And also they will be having TSH suppressive therapy. Why? Because they are taking synthetic thyroid medication because of this thyroid medication of hypothyroidism. So I have taken patients from Vinayaka Mission Homeopathic Medical College. Yeah.
2 more speakers.
Yeah, 5 minutes, sir. It's over.
No, we don't have 5 minutes now.
Okay. Okay. So the sample size is 30 and medications are based on constitutional homeopathic approach. So these are the distribution of patients according to the age. So I have collected from 15 years to 55 years. So these are distribution of patients according to the age. And male is to female ratio. Females are more prone to get hypothyroid. And occupation wise. And prevalence of hypothyroidism according to D-Adamo blood group diet. So O positives are more prone to get hypothyroidism because they are having a low iodine content in their blood. So most of the O positive blood groups are prone to get this hypothyroidism as per my study. And depending upon the types of hypothyroidism, they are more subclinical hypothyroidism, postpartum iodine deficiency, drug induced and autoimmune hypothyroidism. Of this, iodine deficiency is 30%, subclinical is 27%. And as my study is a constitutional approach, I have took case taking as per Vinayaka Mission, and according to that we have prescribed those patients, and these are the medications: arsenic album, calcareous carb, glycopodium, maxol, natramure, phosphorus, sepia and sulfur. The intercurrent medications will be syphilinum, medorinum and thyroidinum. Next, distribution of patients will be, when I took this study, through this I found mild improvement of hypothyroidism in those patients of 30 within a span of 1.5 years. There will, with the constitutional approach, there is a mild improvement.
It was very interesting, but we are short of time and we are running late by half an hour. More than half an hour.
Yeah, in fact, the thing that you showed later on, I think you should have shown first. Because those were findings and those were useful to the other homeopaths. Because normal thyroid and everything we all know, you know. So in a seminar or conference, I think we should put focus on what your research findings are rather than thyroid and everything. Because thyroid everybody knows, you know. So it's a kind of a little bit of waste of time for other delegates, you know. So.
Are you enjoying? Yes. Don't get bored. Homeopathy is very, 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 very long. We have to be patient. Now we have got a special speaker of the day. Special. All the way from Serbia. Dr. Mirjana Zibanov. Please come. Sorry, madam. We are running late. We are running late. Because we have got a big feeling for discussion and sharing information of homeopathy. All the way for you.
Thank you.
So you have got about 25 minutes.
Okay, okay.
Because after there is a Gita Kubjan, then the last one.
Okay,
Thank you. Thank you. Wait. Sorry, I'm taking it with me.
I have been in daily homeopathic practice for 20 years, and today I will share with you my discovery, the spiritual quality after the similimum. What lies beyond the personal code? How to reach the true essence of being through the code. Decoding the similimum. Every remedy carries a code, the deepest essence of its being. The similimum is not only the best matching remedy, but the mirror of the patient's deepest code. The deepest essence of its being. The similimum is not only the best matching remedy, but the mirror of the patient's deepest code. Each code reflects a polarity, a pair of opposites charged with emotional energy. Healing begins when the code is revealed and integrated. Through the simillimum, the hidden essence of the soul becomes visible. Decoding the simillimum. Through 2 decades of walking with thousands of souls, through pain, suffering, polarities, codes, truths, and silences, the space slowly opened within me. A space that was neither knowledge nor technique, a space that had no name. All the fields I explored, yoga, Ayurveda, homeopathy, subconscious work, energy psychology, spiritual technologies, all led to the same place, inner silence. Birth of spiritual quality. In that silence, something unexpected began to happen. Something that had no shape, no emotion, no thought. Something that didn't come from the outside, nor from the mind, but as a quiet ray from the very heart of existence. It was the first encounter with what I would later recognize and name spiritual quality. Decoding the simillimum. We know that the simillimum is one remedy that resonates with the deepest state of the patient. I have found that this state reveals itself as a pair of opposites. When these opposites are integrated, a new level appears, which I call the spiritual quality. Case example. A patient whose simillimum was argentum nitricum experienced integration of the opposites from the code of this remedy, peace, restlessness. After some time, the person began to radiate their spiritual quality, which manifested as watchfulness. Beyond silence. Those of you who have integrated the polarities arrived at silence, and in that silence felt that there is something more. Something deeper, broader, quieter than silence itself. That something is not the end of the journey. It is the place where life truly begins. The radiance before memory. Before the soul became a name. Before experiences shaped a story. Before hands touched the world, there was radiance. Not light, not darkness, but radiance without a source, with no witness, yet all-pervading. That radiance withdrew when we passed through the gate of coding, and when the gate closed, we began to forget. When we forgot, when the 2 cylinders of polarity closed behind us, when and forgetfulness, and then, weary from the search, we sat down in silence. When all else has quieted, in that silence, where nothing matters anymore, where all is welcome, not to the beginning of the path, but to the place from which the path truly begins. How practice led to the discovery of the spiritual quality. Through years of listening, observing, and accompanying patients in their healing journeys, a pattern began to reveal itself. Behind symptoms, behind emotions, behind the surface stories, there was always a polarity. By integrating these opposites, patients were not only healing, but entering into a state beyond healing. That state, subtle, luminous, and constant, is what I came to call the spiritual quality. My realization of the spiritual quality. The realization of the spiritual quality emerged as the fruit of more than 20 years of daily, dedicated work with patients. Through consistent case-taking, I faced both success and failure with courage, always driven by the same aspiration, to deepen my knowledge and uncover deeper truths about the healing process. oneness. Along that long journey, one truth became clear to me. When a person integrates the polarities with a personal code, a state arises in which inner division no longer exists. The person feels that all is one. There are no more words to describe that experience. Only silence, oneness, and peace remain. That is the truth. The emergence of a new presence. But as I continued to follow my patients over the years, as well as my own inner process, I began to observe something new emerging. People didn't remain in absolute silence. A new state began to arise from within, a new quality, a new presence. Asking the essential question, observing this phenomenon, I gave myself the task of recognizing and defining it clearly. In therapy sessions, I began asking a simple question. If now it is no longer this polarity nor the other, what is it? Beyond ego, beyond thought. Unexpectedly, patients responded spontaneously, quickly, and without thinking, naming this new state with a single, simple, pure quality. After receiving this confirmation, in case after case, I understood. This new state is not the result of thought. It is not a construct of the ego. A new, natural state, spiritual quality. It is a new, natural state of being that arises after the integration of the personal code. The spiritual quality is what remains when the personal code dissolves. It is born only when there is no longer any inner division. The discovery of the spiritual quality revealed integration is not the end, it is the beginning of a new state. The discovery of the spiritual quality is a turning point. Why the discovery of the spiritual quality is a turning point? Because it revealed that integration of polarities is not the final step. Something new arises afterward. Because it showed that silence and oneness transform into a living presence. Because it introduced the concept of a new natural state of being, the spiritual quality. Because it opened the door to a deeper understanding of healing and transformation. The path of Master Hahnemann. And of course, there is the most gentle and elegant path for us, the one our Master Hahnemann led us to, the spontaneous integration of polarities, when the patient receives their sole remedy, the simillimum. The depth of change after the simillimum. The depth of change depends on the individual's spiritual maturity. Some will experience the state of the spiritual quality only briefly, others longer, and some for their entire life. But even a short moment in this state leaves a person forever transformed. For a long time, no answer. Yet one question always returned. What lies beyond the personal code? What comes after that? For a long time, there was no answer. Discovery of the question that initiates the spiritual quality. It is neither one opposite nor the other. What is it? I asked myself this question and received the answer: watchfulness. Then I applied it with others, and it proved to work in practice. Ancient knowledge from the subconscious. From my subconscious arose the ancient knowledge of the Slavic antitheses that shaped this question. This is how the discovery came to me, first as an inner insight and later confirmed through practice. A question that awakens awareness. This question first cleans away the accepted facts, then it opens a new clear space from which a higher awareness can be born, an insight into a new state of consciousness. Slavik's antithesis, the power double negation. It is very important to ask the question through double negation, for this structure creates tension, drama, and inner reversal. Like the Slavic antithesis, deeply rooted in our spiritual and literary tradition. It doesn't describe directly, it unveils through denial. Not this, not that. The spiritual quality in practice. In my practice with the matrix method, I have observed that the deepest transformation occurs when the opposites within the patient are recognized and integrated. Each remedy carries a code, a polarity of two opposite states. And when these opposites are integrated, something new appears. The spiritual quality in the patient's words. This new state is not given by the homeopath, but named by the patient in their own words. I call this emergence the spiritual quality. Let me illustrate with 3 cases. The first case is Lamia, with the code attack, defense, and the spiritual quality, reflection. A patient came with carcinoma of the thyroid gland and the uterine fibroid. After case taking, I prescribed her similimum Lamium C200 dead nettle. Her marriage of 15 years had long been without love. She lived in sadness, frustration, and nervous tension. After the remedy, she felt calmer and emotionally stronger. A month later, she entered a new relationship and her partner also became my patient. At follow-up, the fibroid was gone and the thyroid tumor had significantly reduced. In the following video, you will see the follow-up after Lamium was given as the similimum. Kako da aktiviram video? How to activate video? That has to be video.
Technical expert.
A sad je to ublažilo, to nije više tako, kao što je bilo nekada, sad si ti neka druga sanja. Koji bi se, ovo bi sad jedna reč opisivala tebe. To više nije ni napadanje, ni odbrana, nego šta je. Kao neka tvoja nova funkcija. Ne moraš da braniš, ne moram da napadam više. I što sad radim? Kako sad pomažeš ljudima ako ne moraš ni da ih braniš i da ih napadaš, jel? Na poslu, inače, kako sad postižeš, jel? Ne moraš više.
Više sam i posmatrač, kao da ti kažem. Nisam prepustila sam, što ti kažeš, neke stvari. Ne dajem se više toliko, znaš? Ne govorim.
The term was given by the patient herself, not by me as the homeopath. This was a profound shift. Formerly, all her reactions were fiery and passionate. Whether attacking or defending, she reacted with intensity to the death. With integration of the opposites, she reached the highest state, reflection. I think I don't have too much time, and I will. We'll see one more case. The case myosotis, with the code lasting value kitsch, spiritual quality, the common path. A male patient came because of high blood pressure. He had moved. This illustrates the heart of the matrix method. Every remedy has a code, a pair of opposites. When the remedy resonates deeply, the opposites integrate. From this integration arises a new state, a spiritual quality, often named by the patient in their own words. Transformation of codes into spiritual qualities. For Lamium, the code attack, defense transform into reflection. For myosotis, the code lasting value, kitsch, transform into the common path. The true depth of homeopathic healing. This is the true depth of homeopathic healing. Not only the disappearance of physical suffering, but the awakening of a new spiritual quality that reshapes the patient's entire life. Thank you for your attention. I hope I have managed to bring you closer to my discovery. More about my discovery you may find in my new book available on Amazon. Thank you.
Thank you.
Thank you.
Sorry, we are busy.
Yeah, final hypotency. Yeah. So I'll try and be quick so that you.
No. 10 minutes, 15 minutes. But
Okay.
that's the last
No
one.
problem. All right. So the time limit is 10 minutes. All right. So we'll be speaking about evidence-based homeopathy in dermatology. It's a retrospective analysis of skin interventions in community practice. And I'm Dr. Geeta Kupchandani, the Managing Director of Faith Homeopathy Clinic and the Managing Director of Faith Fitness. I'm a licensed menopause expert. I'm the Global Chair of Homeopathy at Ishkama, the Clinical Lead at Arogyam UK program, and the Director of Homeopathy Practice and Research at Bio Wellness Care UK. So that's my introduction. And I will quickly go through this. I don't think we necessarily need to go through this. This is just about my practice and how, and 3 decades I've been treating various conditions. So we'll just run through this. So today I'll be presenting the evidence-based homeopathy in dermatology, a retrospective analysis of skin interventions in community practice. Skin disorders represent a significant global health burden affecting up to 1/3 of the population at some point in life and ranking among the leading causes of non-fatal disease burden worldwide. In the United Kingdom, dermatological conditions are highly prevalent and contribute substantially to reduced quality of life and increased healthcare utilization. Many patients seek homeopathic care, however, systematic reporting from community-based practice remains limited. So this is really important. We need to take care of this. To evaluate outcomes of individualized homeopathic treatment for common dermatological conditions, including eczema, psoriasis, acne, urticaria, over 1 year period, 36 cases were included, each with more than 3 consultations or equal to 3, and more than 3 months of follow-up. The extracted data included diagnosis, prescribed remedy, the potency, treatment duration, and the clinical outcomes. The outcomes were assessed using the standard methods of SCORAD, PASI, and visual analog scales, and patients reported improvements. So we'll go to the statistics. The statistics show, the red bar shows the data where the patient has had these diseases, and the green bar shows the improvement. So the improvement across all cases has been nearly 70 to 90%, and the P is less than 0.001. So which is 1 in 100 cases. Otherwise, 99% cases have had excellent results. And chronic inflammatory conditions like eczema, psoriasis showed a progressive improvement, reaching near complete remission within 6 to 9 months, which is near 90% change. Acne is the condition which had the fastest results within, say, around 3 months of treatment. And along with that, there was a good quality of life improvement as well, because acne is something which does reduce the quality of life. The people are more conscious, they become depressed. So a good quality of life was also observed in these cases. And regarding the potencies, the LM potencies were found to work better than the centesimal potencies. So the conclusion is that individualized homeopathy is associated with statistically significant improvements in both physician-assessed severity scores and patient-reported outcomes across a range of dermatological conditions. The findings contribute to the growing body of real-world evidence in dermatology and highlight the need for larger, systematically designed outcome studies incorporating standardized measures and longer follow-ups. Way forward, this is something which I would like to invite all of you. It is our initiative where research bridges practice. We all are practitioners, we are clinicians. We see so good results with our patients. And we have, say, suppose there is a particular ailment. There's a doctor who has 5 cases where he has seen excellent results in that particular case. There's another doctor who has 3 cases. There's another who has 7 cases. So few of these can collaborate and we can have papers, we can have publications, we have a research team as well. So what we need from you is just the narrative that you have cured this patient. Rest of the work will be done by the research team. So if you just scan the QR code and join the WhatsApp group, it will be really helpful for all of us to collaborate and bring greater research work into homeopathy, which is the need of time. So it is Biohomeostasis Connect. And as we continue to bridge homeopathy and biomedical science, I invite you to be a part of this evolving journey, a collaborative platform where practice informs evidence and evidence transforms practice. Together, let's shape the future of real-world, practice-based research in homeopathy. Let's collaborate, learn, and lead the way toward a new era of scientific, compassionate, and community-connected homeopathy. So I'm Dr. Geeta Khubchandani. I'm the founder of Biohomeostasis Connect, along with Dr. Neha Sharma, who is a research scientist. Special thanks to Dr. Shashi Mohan Sharma, the director of Hahnemann College of Homeopathy, and to Dr. Neha Sharma, who is the chair and managing director of Vedansh Ventures, and Dr. Logeshwari Nalathambi. She is NHS hematology consultant, and she is a great help to our Homeostasis Connect as well. Thank you everyone for listening to me.
Oh my God, very good. You are the best. I don't have a medal to give you.
Thank you so much, Dr. Shashi Mohan Sharma, and thanks to all of you. Thank you.
You are very, very good.
Thank you. Thank you.
Thank you, King. Please take a picture with Dr. Geeta. Memory. Thank you, Sharma, Mr. Sharma. I am Sharma, he is also Sharma, so don't be confused. Lot of people think this is my photography company.
Our research partner is also Sharma.
Yes, Sharmas are everywhere.
Everywhere, yeah.
Okay, now,
Thank you so much.
and patience and waiting for the program to finish. We are nearly there. The last thing is graduation ceremony. We used to have 25 to 35, 40, 70 people. Now the homeopathy is going, but my college is slowing down because I am getting retirement soon. The first certificate will be issued to Madam Sarania. Please come. Because we also start with the ladies. Come here, superhero. Come here. Who's saying out? Stay here. Please come. And my dear Dr. M.K. Raja. Dr. M.K. Raja.
He's not.
Where he is gone?
He's outside.
He's outside. Dr. Laura, please come here. She's also out. This is fellowship in homeopathy. Happy? And get a folder for this, because this is very valuable. So you have to have this thing. Okay? Keep the certificate.
Thank you. Thank you so much.
And next one is superhero from Scotland. Come here, Mr. Chaudhary. Arey aao to yaar. He has got a very, very intelligent wife, my daughter. She's my daughter, Dr. Azma Chaudhary. ले लो भाई वाइफ के लिए ले लो सर्टिफिकेट अदरवाइज शी वांट to cook you for tonight.
Okay, look this as well.
Happy? रुक जाओ 10 पाउंड निकाल लो रुक जाओ हाँ देखा इसको कहते हैं कॉलेज का प्रिंसिपल उसको पता है क्या देना मैंने आपको इसीलिए कॉलेज का प्रिंसिपल नहीं बना रहे इनको थैंक यू all the way from Scotland. So we have got lot of nationality here. It's not international means international. So third one is Dr. Samuel Kwame Fiagbor from Ghana. PG Home London. And my dear friend Abraham, super chairman from Ghana. Super chairman. Please come. My college branch is in Ghana.
Oh wow, great.
You don't know?
Now I know.
Now you know.
Okay. Right, sir. Okay.
Look, international means international. Congratulations, give him the one folder. Yeah? Congratulations. Tell and okay, you got this from London.
Yeah.
Thank you.
Dr. Nikos.
Dr. Nikos from Greece. Dr. Nikos, you are getting this attendance certificate.
Okay.
He is also having college in Greece. I used to visit Greece and my dear doctor friend was very, very nice.
Right, sir.
Thank you.
You wanted to take a photo. You want to make a photo?
Yes, please.
Very intelligent you are. Bulgarians are very intelligent.
Yes, that's why they have very close us.
Congratulations. And now, the most, I've got a new friend. Dr. Samir Chokar introduced me to a very new friend, very intelligent and very, very friendly, very honest, very hardworking, very sensible. Dr. Laura. I tell you something. Dr. Where is my friend? Chairman of Ghana, please come here. President, come here.
President of Ghana. Yes, I'm sure. Even I'm the president of Bulgaria, but they.
You are president, yes. So you can get a visa. Highly passionate, and he is working for homeopathy. So I gave him something special award in Ghana. Yes, this is here. Star of Homeopathy.
Oh, wow.
And today award is going to Dr. Laura. Just a minute. Where is the award? Somebody stole the award.
Oh, Star of Homeopathy.
Star of Homeopathy is given only after a friend is trying for the something like a Nobel Prize. This is bigger than Nobel Prize.
Yeah.
The star is not easy to get.
It's not a common thing.
Should I put it?
Yes.
My dear doctor from I gave her medal and she was putting on Facebook every day. My dear, you put this on her. You can put it now. By the Mumbai hero.
He's my guru. He's the best.
Guru ho jao shuru.
He's the best teacher ever. I'm here thanks to him.
He's the best, second to Hanneman.
Yes.
It's an honor.
Yes.
I'm not including myself, forget.
Okay. I face difficulties.
No, I tell you.
Okay, you're.
He's the prince of Ghana. Yeah.
Yeah, okay.
Thank you.
You stand with them. Yeah. You take a picture again.
Okay.
President.
President
of Ghana.
Star of Ghana.
I tell you magic moment. When I went to Ghana first time, and I was when I landed, the police came in the airplane looking for me. Dr. Sharma, Dr. Sharma, Dr. Sharma. I said, yes, sir. I was frightened. Ghana, new country, first time, maybe they are going to arrest me for something. They said, sir, we are escorting you. And they took me from the diplomatic clearance, no visa, nothing. Sir, out. And outside, they were, I think you were there. And okay. You were there?
Yes,
I was surprised. What's happening? I'm not diplomat. And they took me out from the diplomat and they had a very good time. Thank you, President.
Thank you, President.
And in his town, you won't believe what happened. On the day of celebration, the whole town was there. All the chiefs, 6 foot, 7 foot tall, was there. and the school kids were playing the drums and music. And I was taken like a president of India. Honestly, I've got a video I can share you. And they were so good. They were making clapping. I was surprised. I don't know what was the thing like this. I've got a video here. I can show them. Yeah. That was good for you. Because he is the director. And he presented the program so well. I was very happy. Thank you, President. I make him President there because Obama is nothing compared to him. Laura, please come here. Now you're in team. You're in the cabinet now. Please come here.
Thank you, sir. Thank you.
Clap for him. Thank you. You are listening to me, I listen to you. There is a very good friend sitting, Dr. Balbir Nandra. Next time I'll give you trophy like this. Next time. I give you lecture as well. Thank you. Thank you, sir. Good lecture. I enjoyed. Come on. Put your hand. Laura, put your hand. Thank you for coming. Thank you. Thank you.
Ladies power. Thank you so much.
Dr. Ratan Kumar Roy. Specialist. Colorectal.
The Fisher specialist.
Please.
Congratulations.
Okay. Laura, put your hand. Yeah. Thank you.
Thank you, sir. Very much. Thank you very much. Thank you all.
Oh, my dear Dr. Mehrotra. Vasundhara ji, please come. Very good. Very good lecture. Very good lecture. Your future of homeopathy. Thank you.
Okay.
Vasundhara. Congrats. Thank you. Thank you. Thank you. Dr. Vikas Singhal, very good lecture from Chandigarh, Panchkula. Chandigarh.
Okay.
No, I give you Panchkula free. Please come here. I give you Panchkula free.
Okay, sir. I'm here.
Thank you. Thank you, sir.
Congratulations, sir. Congratulations.
And then one more. Thank you, Dr. Saab. Oh. Very passionate and Dr. Please come here.
Okay.
Thank you. I'll just thank you. Most dangerous man in Mumbai, Dr. Samir Chopkar.
The one and only.
And he is accepting it. He's saying yes, I am most dangerous. Oh, President's doctor. Who is President doctor here?
Nobody.
Dr. A.K. Dwivedi, my brother.
आ जाएंगे सर ये लोग भी निकाल रहे हैं
Dr. Dwivedi.
जी सर मैं आ गया
अविनाश
I am anemic. Give me some medicine.
ए नाम क्या है
ये for Ashwini.
अश्विनी
Kumar is the
Hare Ashwini, God.
Let's call him
इधर
Ashwini
सामने
Kumar
सामने
Dwivedi.
एक से
Yes.
Ashwini Kumar Dwivedi sir. Thank you.
Yes.
Okay. Ready?
Okay.
Okay. One more. Thank you.
Thank you.
Congrats, sir. Congrats.
Oh my God. Oh, dangerous. The Queen of Amarnath. Shefali Roto.
Queen of Amarnath.
Yeah, Queen. Yeah. She was calling me every 2 hours. I'm coming. I say yes, I know.
It was like a dose, allopathic dose. Every 2 hours.
हो गया ओके जी राइट जी
And thank you for the wonderful. She gave me Rolex this morning. Really?
Yes.
Gold Rolex. Don't rob her, please. Oh my God. The most handsome man from Ghana, Swami Pyokbor. Memory of London.
Best dress male.
President, you come as
Best dress male. Best dress.
Best dress superstar. Winner of
You should get the prize of best dress male.
Please come here. President, you come.
Okay.
Best dress.
You remember this? Yes. You showed to Enoch and he will cry because he could not come. Thank you very much. All the way from Ghana.
Okay.
Yeah. Thank you. Welcome. Very good lecture. I couldn't give you more time.
Okay.
Dora, please put the hand.
Thank you very much. Thank you so much, Dr.
Then where are दो हंसों का जोड़ा? Dr. Sameer, they made for each other.
Get your children also.
Children, bring the children.
Bring the children also. Krishna, Krishna, and what is the daughter's name?
One.
Krishna and Sanvi. Hello, congratulations.
He is very smiling hero and he is beating the world record.
Come here.
Okay, look this side page.
Thank you, Dr. Samira. And Madam,
Come.
the best one looking for the children and husband.
Congratulations.
Anybody left? Yes.
Okay.
Yeah, you want to say something. Listen to him carefully.
No. Thank you, Dr. Sharma. I've actually known Dr. Sharma for nearly 30 years now. My father actually had started the Hanuman College, and then he carried the flag forward. So he's done an excellent job so far. Although he's saying he's retiring, but we don't want him to retire. The legacy will go on. Along with him, Dr. Sharma, we want his support, we want his blessings. And Dr. Saurav can just give you a few words on how he's going to carry on further. But he will always be with us.
I'm always with you.
And we thank you very much for it.
Thank you. Saurav, please come.
My turn now?
You are the best one.
I think I don't need a mic. Yeah.
Although sir is saying that he is retiring from like this year and onwards, but in homeopathy, I believe there is no retirement. Right? Even we have 99, we are just writing medicines, seeing patient, talking to neighbors and this and that. So in homeopathy, since there is no retirement, although officially we would be taking over the Hanuman College for the accreditation, student registration, and for all the activities, but he's always there as a mentor, as a patron, and soon you're going to have much more things added to homeopathy and in UK, because I think there is a challenge in UK that people say all kind of things. Homeopathy is struggling, it has a challenge, but we are going to overcome from that challenge. We are going to make homeopathy name to every household. We are going to carry on the legacy of Hanuman College. Sir is here. So we all need your support. Next year we're going to have one elaborated and one large event in homeopathy in UK. That's on 10th, 11th and 12th April. So we invite you all to be part of that event. That is going to start with the World Homeopathic Day celebrations on 10th, followed by a 2 days conference in London, and we are going to make that happen in London. So be ready, and you're most welcome. Thank you so much. Thank you.
Now you have got high-speed electric locomotive. High-speed electric locomotive, the train will go faster. Thank you.
Thank you so much. Thank you.
Bye-bye, and take care. And see you next time.
All the delegates, we can come and take a photograph here.
Please come here. Please come here. Come here.
आगे थोड़ी कुर्सी लगा
Are we all there?
Out of frame?
2 or 3 of you
YouTube अपना हाथ हटाओ यार, वो पहले वो फोटोग्राफी करो, उनका हाथ आ रहा है। 2 मिनट रुक जाओ। Everybody smile.
Yes.
Thank you everyone. Thank you. हमारी कैमरा में एंजॉय के दे ये ना।
Thank you, sir.
चलो बुल्गारिया वाले के लिए अपने कल्याण ले लिए। ये तो अमेरिका दियो।
शक्ल देखो मेरी।
Go back in the place right there. Okay. Go there.
Dr. Samir. Dr. Samir.
Tomorrow Monday. Give me your card. I know. Thank you. Delhi politics.
I think